Introduction. Do you ever have one of those days when you're not quite yourself? When you might feel a lack of energy or interest in what's going on around you? That's fairly normal. It's when those feelings stick around for weeks or months that a mental health professional might diagnose depression. Depression is an emotional roller coaster that can take you by surprise. One day you feel fine, but the next, it's hard to motivate yourself to do anything. Often this triggers symptoms such as an inability to sleep, lack of concentration, and even anxiety. It becomes a ride you can't get off because you become anxious about the experience. You start to watch for other symptoms, and then those periods of depression begin to occur more frequently. You truly feel as if you're on a ride you can't get off. In some cases, anxiety might trigger periods of depression. It can work the other way around too. Certain states of anxiety are normal in humans, part of the fight or flight response mechanism in the body over which you have no control. It's an important function of survival. However, when anxiety occurs frequently, or when a situation doesn't necessarily require that anxiety response, it can negatively affect your otherwise daily habits and peace of mind. The same is true for depression. It's time to learn more about this illness and how it can be treated. Understanding the whys and hows of depression and anxiety in yourself, or maybe someone you love, is important. When you understand what depression is and how it affects the body and mind, you may learn not only how to help yourself, but a friend or loved one. Symptoms and treatments for depression are not a one-size-fits-all approach. If you're struggling with depression, no matter what the cause, it's also important to know and understand what's happening in your brain and the effects it has on your body. Only by understanding it can you take steps to adopt strategies that can help relieve your symptoms. Depression is classified as a mood disorder, but there are several different kinds, which will be covered in this book. Regardless, symptoms of depression can have a detrimental effect on emotions, thought processes, and even your ability to perform daily activities. Depression might be transitory in nature or long-term. In 2023, nearly 4.7% of Americans over the age of 18 experienced regular episodes of depression, and nearly 22% of adults in the U.S. experienced symptoms of depression. For yourself or for a loved one, dealing with depression is challenging, yet there is hope, not only in treatment, but in long-term success in overcoming it. Understanding what causes your depression and anxiety, how the brain functions in reaction to it, and treatments available can support you or loved one and help to alleviate the symptoms of depression and promote relief. Chapter 1. What is depression and what causes it? Depression is not just a state of mind. In many cases, depression can be defined as a disorder or even a malfunction of the brain, and its influence on how a person continuously experiences certain events in their lives. Any state of depression can have a detrimental impact on quality of life. In fact, severe or long-term depression is considered one of the primary and contributing factors for suicide attempts. Many people use the term depressed to define simply being blue, in a funk or moody. However, true depression involves both physiological and psychological symptoms on a daily scale for 2 weeks or more. Your environment and what's going on around you on a daily basis can have a real impact on your mood. However, occasional lapses into those funks don't necessarily mean that you're clinically depressed. Depression is not completely understood, even today. While it can be diagnosed as mild, moderate, or severe, each person's experience with it is unique. It can happen to someone at any age and might be triggered by an imbalance of chemicals in the brain, your family history, hormonal changes, comorbidities, or factors that can influence health and wellness, including an illness or a disease process. So what exactly is depression? In medical terms, depression is defined as a feeling of sadness. Of course, emotions ranging from sadness to joy are normal experiences of our daily lives. So just because you're sad doesn't mean that you're depressed. Sadness is a very natural response to disappointment, loss, trauma, catastrophes, or natural disasters. If you lost your home in a hurricane, of course you're going to be sad. Sadness is a normal and natural state of mind. It's usually relatively short-lived or transitory in nature, typically caused by something upsetting or stressful. Relief can often be found in tears, expression of emotion, and even talking it out with a friend or loved one. Depression, however, is classified as a disorder. It's long-term and often tenacious. For some, it can be overpowering. Grief or bereavement is a very common and normal reaction to many life experiences, from a breakup to a separation to the death of a loved one. However, sadness, loss, and bereavement themselves don't typically cause persistent, often incapacitating depression long-term. One of the most common symptoms of depression is a loss of interest in things going on around you. After a loss, this type of reaction is fairly normal. In most cases, it can last a couple of weeks and will interfere with daily activities. Yet everyone deals differently with the loss of a loved one, so there are no set guidelines as to how long a person should grieve such a loss. Different types of depression have been identified, but again, it's important to remember that not everyone fits into a specific category. The first step toward learning more about depression is to realize there is more than one kind. Before moving on, note that symptoms are those expressed. Signs are physical in nature. Clinical depression, also known as major depression, is not the type of depression that's typically caused by the loss of a loved one or disappointment or a medical condition. Clinical depression is defined as a mood disorder, and in many cases, the cause of depression is difficult to determine. In some cases, clinical depression involves an imbalance of some sort in brain chemicals known as neurotransmitters. In other cases, genetics or heredity, drug or alcohol dependence, and trauma, mental or physical, can contribute. Major depression also defines a state of being where a person's somber or even dark mood is ever present. Some define it as all-encompassing. A handful of the most common symptoms of clinical depression include, but are not limited to, random and unexpected outbursts, from anger to crying, intense feelings of sadness and or despair, extreme sense of tiredness or complete lack of energy, noticeable change in sleeping habits or patterns, changes in appetite, eating more or eating less, difficulty concentrating or focusing, loss of interest in socialization or activities, frequent thoughts of death and or suicide, a general sense of anxiety or nervousness, avoidance of social activities or familial gatherings, or any type of human interaction, sudden and often surprising episodes of crying. Physical responses to clinical depression can include headaches, digestive problems, and aches and pains whose source cannot be identified. In many scenarios, clinical depression is more noticeable in a person or loved one because it causes more noticeable changes in the personality or behaviors of the person experiencing it. Clinical depression is often diagnosed by a mental health professional if your depression lasts more than 2 years. This type of depression is also known as a persistent depressive disorder, or dysthymia. A person experiencing a persistent depressive disorder may experience chronic or long-term, though a milder form of depression. In other words, a person is able to maintain day-to-day functions, but may claim to feel low the majority of the time. In many cases, persistent depressive disorder is diagnosed if it has lasted for 2 years. Some of the symptoms of persistent depressive disorder include, in addition to those mentioned above, trouble making decisions, decreased productivity, withdrawal from social interaction, feeling guilty or responsible for events of the past, an overall sense of hopelessness. Non-clinical depression, often called situational depression, is a more temporary form of depression that is caused by life changes or extreme stress. Some common triggers of situational depression include death of a loved one, a divorce, financial difficulties, and job loss. Some of the most common symptoms associated with situational depression include sleeping difficulties, frequent bouts of crying, lack of energy and overall body fatigue, lack of interest in daily activities, persistent sadness, difficulty concentrating. Note that some of the symptoms of non-clinical depression are similar to those of clinical depression. Both can have a detrimental impact on the psyche and the body. Clinical depression can lead to erratic sleep patterns, such as difficulty sleeping or longer than normal sleeping. Changes in appetite are often noted, which can lead to overeating or not wanting to eat at all. A person struggling with this type of depression might complain of extreme fatigue or very low energy. When it comes to the psyche, non-clinical depression can contribute to a constant feeling of nervousness or worry, even if the source is not identified. Extreme anxiety, from shortness of breath to heart palpitations, can lead to more severe symptoms and can trigger a panic attack that presents much like a heart attack in medical care scenarios. It's also important to keep in mind that both non-clinical, situational, and clinical depression can also present with thoughts of suicide or talk of death or dying. SAD. What about SAD? Anyone who has not experienced seasonal affective disorder may snicker or even shake their heads at it, but it is a serious type of depression that typically occurs during the colder months of the year. It often rears its head in the fall when nights grow longer. This type of disorder is believed to interrupt normal daily circadian rhythms and can even alter the production of certain neurotransmitters like serotonin and melatonin. Depression during winter months can often contribute to feelings of laziness or even apathy in some. Like other forms of depression, it should always be treated seriously. Some of the most common symptoms of SAD include lethargy, periods of disturbed or erratic sleep, difficulty being around others, negative thoughts, overeating, especially in cravings for carbs or sweets, difficulty concentrating. SAD is transitory in nature and often resolves on its own, though some may need some extra help in the form of over-the-counter or prescription medications to deal with the symptoms. Other types of depression. Another type of depression is defined as melancholia, or simply feeling melancholy. Melancholy is more than just feeling sad and is often pensive in nature. This type of depression often leads to moodiness and negativity, though for no particular reason. It may sound mild, but it's a severe type of depression that is often difficult to treat because the person experiencing it may not even be able to define the why of it. In its simplest terms, melancholia defines an individual who has completely lost their ability to take pleasure or joy in many aspects of their life, or in any of it. Psychotic depression is another type of depression that is more often associated with someone who has a mental condition or a diagnosis where they are unable to maintain a solid grasp on reality. This type of depression can also involve hallucinations or delusions that can often lead to paranoia. Bipolar disorder is another term for manic depression, wherein an individual may experience periods of depression or periods of overstimulation or mania, although some do maintain their equilibrium in between these two vast emotional swings. Bipolar depression can be associated with manic depression or experienced on its own. This type of depression causes a person feeling down or depressed, as above, with periods of severe depression intermixed. Picture yourself being below the surface of water. You can see the surface but can't reach it. Every so often, something causes you to drop down so deep that you can no longer see the light of the surface. A few types of depression can also target specifically women, including the often joked about premenstrual syndrome, or PMS. Some of the most common symptoms of PMS, also known as premenstrual dysphoric disorder, include but are not limited to general body aches, irritability and nervousness, fatigue, a sense of hopelessness or sadness, increased appetite and/or food cravings, severe mood swings. The same holds true for women going through menopause. Both cause drastic changes in chemical balances in the body. The same applies to women going through pregnancy as well as those who have recently given birth, in a condition known as postpartum depression, or PPD. PMS and PPD are most often caused by erratic hormone production and leaves the woman at the mercy of these chemicals in the body that have a serious impact on personality, mood, and attitudes. Some of the more common symptoms of postpartum depression can include sudden and uncontrollable bursts of irritability, anger, and rage, extreme nervousness, persistent feelings of sadness, sleep difficulties, feeling overwhelmed, inability to connect with others, lack of focus or concentration, withdrawal from family and/or friends. Hormones have a huge influence on how a person feels, and anything that affects the otherwise normal balance of hormones and/or neurotransmitters in the body can negatively affect mood, emotion, and even behaviors. Erratic mood swings are often noted in depression scenarios that are unique to women, and they are no joking matter. These symptoms also present in men, albeit sometimes in different manners. Treatment for such conditions is as important as it is for other types of depression. Keep in mind that a person experiencing depression doesn't care what name it's given. While such determinations may provide a mental health expert with a direction to go in regarding treatment, they all have a detrimental effect on the person experiencing it. Depression causes a multitude of challenges to overall mental and physical health and well-being. Determining not only the type of depression, but the cause, can support relief of symptoms and possible recovery. In many cases, a number of factors can influence any form of depression, including psychological, biological, and environmental stimulus. For example, some biological influences on depression can include anything from overstimulated stress response to changes in the brain, damage to the immune system, and even heredity or genetics. Environmental factors can include trauma, lifestyle, one's social or economic status, loneliness, or a lack of a social network. Psychological factors can include inadequate coping mechanisms, personality, childhood development, and so forth. Clinical and non-clinical depression affects all age groups and genders and socioeconomic levels. With support from family, friends, or loved ones, and mental health professionals, treatments can improve quality of life, as well as reduce symptoms for those struggling with depression. As you read through this and the following chapter, you may catch yourself thinking, "That's how I feel." Learning to identify what your specific symptoms are is a major step in treating yourself. This is not the only step in the process, but it's a good first one. Chapter 2: Anxiety and Depression. Anxiety, like depression, includes a variety of types as well as causes. In medical lingo, anxiety is defined as a disorder that implies a state of distress that can be either intermittent or chronic in nature, like depression, and triggers a nervousness that is quite severe, sometimes even inappropriate depending on a person's circumstances. Anxiety is a perfectly normal response to physical as well as psychological stress. Anxiety, fear, and intense stress can often trigger the fight or flight response in the body. This response is an automatic reaction by your body that occurs when you sense any kind of danger. For example, a person faced with a fire will feel anxious or frightened, which induces a fight or flight response in the body. The fight or flight response triggers a number of physical changes in the body, including an increase in blood pressure. The increased flow of blood races to the muscles in your heart, providing the body with required strength and energy to deal with a potentially life-threatening problem. In other words, your body is triggered into this response by your mind, based on your own feelings and emotions. Your body's response doesn't recognize and rate your fears or anxiety. It simply responds. So whether you're facing an aggressive animal or even a mugger, your body will react. So too might your body react in the same way for someone who is overwhelmed with the thought of making a speech in front of an audience, or who feels uncomfortable being in a large gathering. Anxiety is anxiety. Fear is fear. They both evoke the same body response. In some cases, you can control those responses to a certain degree. For others, it's extremely difficult. This heightened response and its after effects are quite common in soldiers who have been in combat, as well as firefighters and law enforcement personnel who face a wide range of emotions on a daily basis. The fight or flight response is triggered by worry, anxiety, fear, and danger. That being said, anxiety can often also occur at unusual times, even inappropriate times, and in situations that don't involve danger to a life or limb. A person can grow anxious over having to meet their in-laws for the first time, or on their first day of school, or starting a new job. At times, anxiety can trigger such intense feelings and fears, even if they're unfounded, that a person may be diagnosed with an anxiety disorder. A number of anxiety disorders are recognized and treated today. They include generalized anxiety disorder, panic attacks, phobias, obsessive-compulsive disorders, and post-traumatic stress disorder, or PTSD. In many cases, anxiety can overlap depression and vice versa. Being aware of what anxiety is and how it affects both mental and physical health is crucial. What is anxiety and how does it affect physical and mental health? Anxiety might be considered an emotion or mental state by many, but someone with anxiety may experience both psychological and physical factors when it comes to triggers or causes. In medical scenarios, anxiety is often treated through psychological approaches because it is typically triggered by an emotional response to an environmental stressor. A few examples of an environmental stressor may be the end of a relationship, a divorce, a new baby, or yes, even a life-threatening disaster, such as an earthquake or a tornado. A sense of fear, worry, and uncertainty is normal in such circumstances. During such responses, you may notice that your heart is racing, that you're breathing faster than you normally do, or that your hands are trembling. Some people feel as if their whole body is trembling. Others experience a sense of confusion or even missing gaps in time. This type of response isn't always limited to potentially dangerous situations. Have you ever walked into a dark room and think that you see something moving in the shadows? You freeze. When you're lying in bed at night and it's quiet but your dog suddenly barks, do you jump? When somebody startles you, do you place your hand over your heart and then sigh with relief? These are all fear responses or startled reflexes of the body, caused by a surge of adrenaline. That surge of adrenaline is what gets you ready to turn and flee, otherwise known as the fight or flight response. However, when a person is anxious or stressed over a long period of time, it's easy to become overwhelmed by any number of scenarios, even if they're not life-threatening or scary. The body is in a state of hyper-awareness. The response goes beyond typical nervousness and induces symptoms that include a rapid heart rate, tremors, sweating, or even that sick feeling in the pit of your stomach. In some cases, anxiety can be caused by a physical disorder or certain drugs or medications. Anxiety can also be caused by chemical imbalances in the body, such as an overactive gland, such as the thyroid or adrenal glands. These flood your body with cortisol, epinephrine, also known as adrenaline, and norepinephrine. Hormone-related anxiety causes a number of symptoms, including, but not limited to, irritability, difficulties focusing or concentrating, a sense of restlessness, excessive worrying, accelerated heart rate. When not controlled, anxiety can lead to recurrent panic attacks and/or social isolation. Anxiety can also lead to depression. Again, keep in mind that some anxiety and stress are normal in your everyday life. It's when the body is constantly stressed that more serious issues can occur, such as development of an anxiety disorder. Don't let the term disorder throw you off or imply weakness. It's simply medical speak. If you constantly struggle with anxiety, you're not alone. According to recent data, anxiety and anxiety disorders are relatively common. Anxiety affects more than 40 million adults every year. As with depression, there are several different types of anxiety. Generalized anxiety disorder. Generalized anxiety disorder, GAD, affects nearly 7 million adults of the population in the U.S. alone. This anxiety disorder is more common among women than men, but it can start at any age. For most people experiencing it, it fluctuates. While it can persist for years, it doesn't necessarily mean that anxiety is constant. Many times people experiencing this will describe themselves as worriers. In many cases, a person diagnosed with generalized anxiety disorder, or GAD, can't really identify what exactly is causing the anxiety. Nevertheless, they do feel a very frequent sense of worry, uncertainty, or even distress that they are unable to get a handle on. In most cases, however, this feeling of anxiety can range from mild to severe, from infrequent to frequent, and from short-term to long-term. This constant state of fight or flight can lead to depression. This state of worry or anxiety is typically general in nature, hence its name, and can include anything from daily work responsibilities to worrying about one's health, finances, children, or anything else that affects daily life. Some of the most common symptoms of generalized anxiety disorder include disturbed sleep, muscle tension that often leads to stiff neck and shoulder complaints, difficulty focusing, tiring easily, and sometimes a sense of restlessness. Have you ever tried to go to sleep but find yourself tensing up? You tell yourself to calm down and mentally focus on relaxing the muscles, only to find them tense again a few minutes later. Anxiety and depression can also be triggered by medical issues or even the drugs used to treat them. A person who has experienced some type of head injury or neurologic injury may exhibit signs and complaints of anxiety. Yet, so too can a person diagnosed with heart condition. Some medical conditions like chronic obstructive pulmonary disease, COPD, or asthma can also cause anxiety. In some cases, a state of anxiety, including those under the umbrella of generalized anxiety disorders, can be made worse by consumption of stimulants such as caffeine. Alcohol may make the problem worse, as alcohol is a depressant. Street drugs such as cocaine, as well as prescription drugs, including decongestants and some over-the-counter weight loss products, can cause anxiety or nervous reactions, especially if they contain a combination of caffeine and ephedrine. As mentioned, fears and worries are a normal part of the human existence. It's when those periods of anxiety start interfering with your daily habits or affect how you interact with others that you need to take notice. Another type of anxiety can severely restrict your ability to socialize. Social anxiety disorder. Social anxiety disorder is another one of those anxiety issues that can cause depression or the other way around. Being depressed and anxious can severely interfere with a person's desire or ability to socialize. This disorder, more commonly known as SAD, not to be confused with seasonal affective disorder. I know, who comes up with these names? Probably men. Affects nearly 15 million adults in the US. Humans are mostly social creatures and have the ability to blend comfortably into a variety of social situations that can include more than just a spouse or family. Socialization at work, school, and in developing relationships is part of an otherwise normal human experience. Of course, it's perfectly normal to be nervous on your first day of school or when walking into a new job site for the first time. Yet some people dealing with anxiety or depression may avoid social situations, so much so that they avoid engaging at all, and when or if they do, it's incredibly difficult and may even be distressing. This isn't to say that someone who is shy, reserved, or even timid has a social anxiety issue. Some of the most common symptoms a person with this type of anxiety may experience include, but is not limited to, blushing, sweating, shaky voice, easily distracted, difficulty expressing themselves. For some, such reactions are overwhelming. This type of reaction might be more common among those who are not used to being in crowded scenarios, or those who generally limit their social circle to a few close friends and loved ones. Social anxiety disorders are relatively common with those who are diagnosed as depressed, and treatments might often include an antidepressant or anti-anxiety medications. Experiencing some of these situations, symptoms, or feelings on occasion is fairly common for many, but they should not be enough to wholly curtail your life experiences. However, another type of anxiety that is not only related closely to stress, but also depression, is post-traumatic stress disorder, or PTSD. PTSD. Post-traumatic stress disorder, PTSD, is defined as a type of anxiety caused by exposure to frightening and/or traumatic events or experiences. Post-traumatic stress is often experienced by combat soldiers, first responders, and anyone who has survived a traumatic or life-threatening incident, whether it's a car accident, a crime, or a disaster. A large number of those that struggle with this may also have experienced childhood sexual abuse or trauma. Recent studies have shown that 7% out of 100 veterans will experience varying levels of PTSD, but that 6% out of 100 of the overall population can also experience episodes of PTSD throughout their life. PTSD is commonly triggered after someone has experienced or seen something life-threatening. In many cases, that person might start to recover and feel better within a few months. However, whatever the trauma, some continue to have negative reactions that affects their daily life. They find it difficult to go through the motions, such as going to work, school, or enjoying activities that they used to like. For some, it gets so bad that a person may not even want to be around their own family, and they isolate themselves. Post-traumatic stress doesn't always occur right after a traumatic or frightening or life-threatening event. Sometimes it can take months or years for the symptoms of PTSD to emerge. Unfortunately, this is true for many combat veterans who are exposed to long-lasting or intense traumatic events, and those who have been injured. However, not every soldier, not every accident survivor, or one who has survived a life-threatening event develops PTSD. Why? Age, gender, personality, and the type of trauma a person has experienced also plays a role in how a person reacts to it. Someone who is feeling depressed or has been diagnosed as depressed doesn't necessarily mean that the individual has a personality disorder. They may not have had a childhood trauma, poor parenting, nor do they have a weak character. In addition, culture, race, and social classes don't necessarily increase a person's risk to experience depression in their lifetime. Women are twice as likely as men to experience depression, most commonly because of fluctuating hormone levels. Changes in hormone levels can trigger mood changes, as can some oral contraceptives and hormone replacement therapies. PTSD events can be infrequent and may last over a number of years. Episodes of PTSD can be frightening for family and loved ones, and challenging for health professionals to diagnose and treat. PTSD symptoms are not the same for every person. For example, some may experience nightmares or flashbacks, sometimes triggered by a smell or sound. Others may not. Reactions differ in each individual. For example, if the PTSD had been triggered by a vehicle accident, the person may avoid driving. Some people experiencing this kind of anxiety and stress don't want to talk about it, while others try to convey what they're feeling, sometimes with mixed results. Some people feel guilty for feeling the way they do, while others lash out with anger or irritability because they believe that no one can possibly understand what they're feeling. People experiencing symptoms of PTSD may also deal with depression. Periods of depression are not unusual after experiencing a trauma. However, an inability to cope with the symptoms of any type of anxiety or its cause can lead to depression, and often symptoms overlap. In some cases, developing a sense of apathy, not caring about anything, is not unusual. When symptoms of anxiety become symptoms of depression, a person might feel as if they're caught in a vicious circle. The link between depression and anxiety is not disputed. For some, anxiety may lead to depression, while for others, depression may lead to anxiety. It can seem to morph into a never-ending cycle. Why does this happen? Why do some people experience depression and anxiety, and others don't? Chapter 3. What's going on in my head? In order to gain a greater understanding of depression and anxiety, and how it affects your life, a brief overview of the function of the nervous system, which includes the brain, is necessary. Don't be alarmed. This isn't going to be an in-depth lecture on brain anatomy and its trillions of synapses, the pathway between nerve cells. However, a brief glimpse into the brain and how it influences your emotion is another important step in not only understanding depression and anxiety, but in finding ways to deal with them. So let's get started. The nervous system is composed of two very different parts. The central nervous system includes the brain and the spinal cord, and the peripheral nervous system, the nerves outside the brain and spinal cord. Messages are passed along from one nerve cell to another, or along nerve pathways or fibers. These messages are carried by what are called neurotransmitters. These transmitters send impulses from one nerve cell to another in a very complex type of communication. Another type of messenger is called a neuromodulator. While a neurotransmitter encourages nerve impulses, neuromodulators are able to regulate, for lack of a better word, the intensity of those messages. Synapses are small gaps that are found between nerve cells. The synapse is where neurons talk to one another. This communication could be giving a direction, an order that needs to be passed along a route, to another until it reaches its destination, like to increase the heart rate, or to take your finger away from something that's hot. You can think of these nerve cells and their synapses as a highway that transports chemical or electrical signals from the brain to your vital organs, your muscles, and even your skin. This communication occurs both to and from the central nervous system. Neurons are essential to life. You have billions of them just in your brain. Neurotransmitters, as mentioned above, are the vehicle that transports those messages from the neuron at the synapse, passing the message along from one to the other until it reaches its final destination. For example, dopamine is a neurotransmitter and a hormone that is manufactured in several areas of the brain, including the hypothalamus. This chemical messenger has the capability of improving a person's mood and emotions. It's also important in aspects of motivation, learning, and promoting a sense of satisfaction. It's one of several feel-good neurotransmitters of the brain. The brain enables us to understand language, mathematics, communication, and fantasy. It receives and interprets all stimuli that not only comes from our five senses, but internal functions as well. If you touch something hot, nerve cells, neurons, send impulses from the very tip of your finger racing to the brain, which sends a pain signal back telling you, ouch, and you jerk your finger away from the heat. The brain's job is to protect every function of the body as well as to make minor adjustments when necessary in those functions. As such, the brain is also capable of not only adjusting your levels of alertness, but also your state of consciousness, as well as mood. Nerve impulses in the brain flow along nerve fibers and result in brain activity. However, nerves are not infallible. Some nerves can break down, such as with people diagnosed with conditions like Parkinson's disease, Alzheimer's, or other forms of dementia. A bacteria or virus can infect the spinal cord or the brain, causing a variety of malfunctions. A clot that blocks oxygen and nutrients from arriving at the nerve will also lead to damage. Despite decades of study, the functions of the brain are still not completely understood. The brain is a remarkable organ and is still wreathed in mystery. Your brain controls your memories, your thoughts, your moods, and your behaviors. It functions quite literally as the command center for your entire body. It gives you the ability to experience the five senses: touch, smell, taste, hearing, and sight. In other words, it enables you to see what's around you and your environment. It allows you to see and smell and touch and hear. These impressions, once they make their way into your brain, can also make you feel. When you smell something good, what do? You may sigh with contentment or smile. When you see something cute, like a baby chicken, how do you feel? When you smell smoke, what does your body do? These are just a few of the sensations/feelings a single sense can promote in your body. Amazing, right? Every area of the brain has a function or primary job. For example, the limbic system, which is a system of nerve fibers, also operates in the brain. The limbic system is connected to the hypothalamus gland deep in the brain, and also to your frontal and temporal lobes. What's the big deal about the limbic system? Seriously, don't get bored just yet. The limbic system controls expression of emotions. Because of its potential to produce emotions that can include sadness, fear, pleasure, or anger, the system is very important in enabling people to behave in a way that helps them to communicate with others. The hippocampus is an important gland that involves the formation as well as the retrieval of memories. Memories that are filled with emotions are easier for you to remember or recall than those that aren't. So there is the connection between what goes on in the brain and how you're feeling. The number of neurotransmitters and neuromodulators that function within the brain range in the hundreds. Inside your brain, there are billions of connections within the neurons, those neurotransmitters, and neuromodulators. But exactly how do they work, and why are they important for those experiencing depression or anxiety? Let's find out. Depression and the brain. Several important neurotransmitters have an influence on depression, stress, and anxiety. These include serotonin and norepinephrine. It has long been believed that a deficiency of either of these two neurotransmitters are primarily responsible for depression. However, advances in research have also explored other causes. For example, researchers have also long explored the possible link between chronic stress and depression and/or anxiety that might be caused by damaged nerve cell connections or nerve fiber pathways. So let's take a look at a few of the primary neurotransmitters in the brain and what they do. Serotonin. Serotonin is a neurotransmitter that aids in the communication between brain cells and nervous system cells of your body. Remember the difference between the central nervous system and the peripheral nervous system? Serotonin in the form of chemical messages can instruct your body and how it functions. It has a huge role in a number of physical functions of the body, such as bone health, blood clotting, and digestion. But it also has an influence on your mood. As with other neurotransmitters and hormones, lack of serotonin can play a large part in not only depression, but in stress and anxiety as well. Oddly enough, serotonin is primarily manufactured in the intestines. From there, the neurotransmitter is released into the bloodstream where it's absorbed by blood cells known as platelets. Only a small amount of serotonin is manufactured in the brain by the hypothalamus and the pineal gland, located deep in the brain. As a note of interest, this tiny gland is about the size of a rice grain, but its power is massive. The pineal gland is part of the endocrine system, responsible for hormone balances in the body. The pineal gland is primarily responsible for producing melatonin, which is why it's been given the nickname the sleep hormone. Regardless of its origins, serotonin has an influence on a number of functions, including mood modulation. That's why this neurotransmitter has also been given a nickname. Serotonin is known as a mood regulator, and is also known as a feel-good hormone. When levels of serotonin are level, you tend to feel a sense of calm or stability. You may find it's easier to absorb information, to do your work, and promote a sense of well-being. If your serotonin levels are low, you might be more likely to feel down or depressed and anxious. Serotonin levels can be inadequate if your brain lacks an adequate number of serotonin receptors, or if they're not working properly. Think of receptors as cups. When your serotonin cups are empty, you may experience negative emotions, such as anxiety, a lack of motivation, and may find it more difficult to concentrate or focus. Getting those cups refilled aids in improving mood and outlook. Dopamine. As briefly mentioned above, dopamine is another one of those feel-good neurotransmitters that encourages a person to experience pleasure, whether it's the taste of a piece of chocolate cake or the smell of a flower that prompts a smile. The release of dopamine in the brain is known as a motivator, one that makes you curious, interested, or promotes some type of activity or action. In other words, dopamine encourages an interest in life and what's around you. As with anything, moderation and balance of dopamine is key. If the brain manufactures too much or too little, you may experience a variety of symptoms or changes, such as lack of quality of sleep, attention or ability to concentrate, motivation, learning. This single neurotransmitter/hormone can have a huge impact on how you go through your daily life and how you feel about it. An imbalance of any of the major or primary mood stabilizing hormones/neurotransmitters can have a very real effect on your thought processes, your emotions, and your ability to motivate yourself. Hormones can also have an influence on how you feel. A class of those, known as endorphins, are also considered a happy hormone. Endorphins give you that sense of contentment or well-being, as well as being considered the body's natural pain reliever. There are roughly 20 endorphins in the body, produced by different glands. Did you know that when you laugh, your body produces and releases endorphins? When you eat something yummy, your body releases endorphins. Now that you know the basics of how these neurotransmitters, neuromodulators, and hormones work, you are now better able to understand what's going on in your head. A number of medications can help to improve serotonin and dopamine production in the brain. So too can medicines that help modulate release of stress hormones. Knowing what they are and how they work is also an important step toward treating depression and anxiety, either on your own or with the help of a medical professional. Note: if you find that attempting to relieve your symptoms of depression or anxiety don't respond in yourself or a loved one, don't hesitate to seek medical help. Stress hormones and how they affect depression. How does depression happen? One theory is that long-term or chronic stress or anxiety can negatively affect the nerve connections or pathways between brain cells. Once again, think of these nerve connections as a road. That road leads you to a canyon, the synapse, but there is no bridge for you to cross from one side to the other. That lack of a bridge can be equated to the lack of neuron connections between the nerve cells in the brain trying to transmit messages. While you have a number of feel-good neurotransmitters and hormones in the body, you also have hormonal glands that are negatively affected by anxiety and stress. A primary stress hormone, known as cortisol, is manufactured in the adrenal glands. These glands sit on top of your kidneys like little hats. However, in the depths of the brain, the hypothalamus and the pituitary gland are responsible for assessing body functions, and these glands determine whether cortisol levels in the blood are adequate, too high or too low. When too low, these two glands found in the brain send signals to the adrenals to manufacture more. When there's too much cortisol in the blood, it sends a signal telling them to stop. A person who is constantly anxious or stressed, or who experiences chronic stress in their lives, triggers a nearly never-ending stream of cortisol hormone into the bloodstream. That hormone also affects areas of the brain that control emotion, such as mood, anxiety, and fear. Cortisol isn't a bad hormone. It's essential. It also fluctuates on a daily basis, sometimes hour by hour. The more cortisol floating around in your bloodstream, the more likely you are to feel anxious, fidgety, or even physical symptoms like an increased heart rate, a nervous stomach, or stress-induced headaches. As mentioned earlier, cortisol can initiate the fight or flight response, which is a necessary and very valuable aspect of safety. For many, when the stress goes away, the levels of cortisol return to normal in the body. The person who is experiencing chronic stress or long-term anxiety, regardless of circumstances, has an increased risk of higher levels of cortisol floating around. It's important to know that cortisol is also an important hormone that also regulates your metabolism, your blood sugar or glucose levels, and other major functions in the body. Whether depression causes the stress or the stress causes the depression, the effect is the same on your body. While not everyone with high cortisol levels will experience depression, it can lead to an increased risk. It's also important to remember that everyone responds differently to stress, anxiety, and even depression. Chapter 4: Medications for Depression. A number of therapies and treatments can aid those experiencing depression, but before those are discussed, it's important to discuss the value of medications. Many people feeling depressed or stressed first take steps that don't require medication. However, if your symptoms don't improve, don't hesitate to take the next step in your journey towards relief. Drug therapies continue to be among the most effective treatments for depression. Again, it's important to remember that just because a person is diagnosed with depression or is taking medications to treat it, does not imply weakness of mental capacity or lack of abilities, strength, or character. Familiarize yourself with the most common types of drug therapies. They include selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, tricyclic antidepressants, monoamine oxidase inhibitors, MAOIs, and other antidepressants, such as combinations of drugs. In most cases, these drugs need to be taken on a routine basis for several weeks before a person begins to notice their effect. In many cases, antidepressants provide some relief for those experiencing depression, but it's important to be aware that they also come with some side effects. Sometimes one type of medication will work better than another. Some people might need to try more than one to find the one that works best for them, or in a combination that provides the results you're looking for. As difficult as it is, patience is the key. Understanding how each of these classifications of drugs work and possible side effects associated with them is important for anyone considering drug therapy. Selective serotonin reuptake inhibitors, SSRIs. Selective serotonin reuptake inhibitors are a newer type of commonly used antidepressant, effective in treating not only depression, but a number of other disorders that often exist along with depression. These are typically the first line of treatment used by providers. The term reuptake implies blocking or reabsorption of neurotransmitters. Think of it this way. The neurotransmitter, serotonin for example, is produced by nerve cells. Chemical messengers like serotonin communicate with each other. When a nerve releases serotonin, it flows into a space around the nerve cell. The serotonin has two options. It can either attach to the receptors of another nearby nerve cell surface, or float around the space and reattach itself to the receptors on the nerve that produced it in the first place. In other words, reuptake is a complicated way of saying recycling. When the brain determines that a balance of serotonin has been achieved, a selective serotonin reuptake inhibitor, SSRI, effectively blocks the serotonin from being reabsorbed and released again by the nerve cells. As you recall, serotonin is often nicknamed the feel-good hormone because the messages it transmits along neural pathways promotes a sense of well-being and a more positive mood, as well as stimulating the appetite. In the past, it was believed that low levels of serotonin cause depression, but research has determined that lack of serotonin is not the only contributing factor when it comes to depression. But let us not digress. A few common types of SSRIs include, but are not limited to, the brand names and generic names: Lexapro, escitalopram, Celexa, citalopram, Prozac, fluoxetine, Zoloft, sertraline, Viibryd, vilazodone. Side effects of SSRIs are typically mild and temporary, though they may cause some side effects including diarrhea, nausea, weight loss, headaches, tremors. Most people tolerate the side effects of SSRIs better than older types of depression treatments, and are safer in regard to heart function. Even so, it must be noted that long-term use of SSRIs can lead to weight gain. You should never abruptly discontinue SSRIs due to negative side effects that can include, but are not limited to, irritability, anxiety, dizziness, and some flu-like symptoms. Serotonin norepinephrine reuptake inhibitors, SNRIs. Serotonin and norepinephrine reuptake inhibitors are a combination of drugs that act together. They are often used in treating anxiety disorders, as well as major depressive disorders, MDD, and other conditions. They, like other antidepressants, are designed to relieve depression by improving the communication between brain cells and nerve networks that have an effect on mood. SNRIs have an influence on the neurotransmitters/chemical messengers in the brain. They are effective in altering brain chemistry, as well as communication between brain nerve cells. A combination serotonin and norepinephrine antidepressant is effective in blocking the recycling of transmitters, not only of serotonin, but norepinephrine within the brain. A number of SNRIs have been approved by the FDA. Here's the brand name and generic names: Cymbalta, duloxetine, Pristiq, desvenlafaxine, Effexor XR, venlafaxine, Fatsima, levomelnazepran, Savella, milnacipran. Some side effects are noted with use of SNRIs, similar to other antidepressants. This is not to say that everyone experiences side effects, because some people don't. The side effects of SNRIs are typically mild and will decrease following several weeks of use. Physicians may recommend taking the medication with food to reduce the risk of upset stomach or nausea. It should be noted that some SNRIs, depending on the general health of an individual, may increase blood pressure and can interact with other drugs. Always discuss such issues with your healthcare provider. Some of the more common side effects of an SNRI include dizziness, headache, dry mouth, upset stomach or nausea, sweating, heart palpitations. A word about serotonin syndrome. Though not a typical side effect of antidepressants, use of SNRIs can cause the levels of serotonin in your body to increase. As with anything, moderation is key, so too much serotonin in the blood is not good. Serotonin syndrome is a very serious issue and can sometimes be life-threatening. The difficulty confronted by many healthcare providers in diagnosing this syndrome is the difference in presentation of symptoms, as well as their severity. For some, symptoms of serotonin syndrome can begin within a short time frame when dosages have been increased, some within hours, or in combination with other medications that contain serotonin. Some can take longer, even weeks or more. Symptoms run the gamut and range from a mildly elevated blood pressure, tremors, or accelerated heart rate, tachycardia. Some develop fever, some don't. Moderate symptoms can include difficulty with vision, difficulty speaking, and elevated temperature. Some may present with all of the above symptoms, while others can present with muscle rigidity, confusion, seizures, and acute respiratory distress. In severe cases, clotting and even death is a possibility. Unfortunately, there is no single diagnostic test that can confirm serotonin syndrome. Instead, physicians are often left to run tests or diagnostics of exclusion. It should be noted that some physicians will determine a diagnosis of serotonin syndrome to err on the side of caution and begin to treat symptoms rapidly in order to reduce risk of morbidity factors or death. Precise details regarding symptoms as well as their onset are important in regard to treatment. Individuals who are prescribed serotonin reuptake inhibitors should be aware of serotonin syndrome and be comfortable in discussing the syndrome and its dangers with their physician. Tricyclic antidepressants. A few common tricyclic antidepressants, also known as TCAs, include, but are not limited to, these brand name and generic names: tofranil, imipramine, Elavil, amitriptyline, anafranil, clonipramine, Sinequan, doxepin, norepinephrine, diazepam. It's long been believed that tricyclic antidepressants can help increase the levels of neurotransmitters in the brain, such as serotonin or norepinephrine. The latter can aid in increasing attention and also help to modulate a person's emotional responses. You've already read about serotonin. This group of antidepressants are among the oldest of drugs used to treat depression. However, they also come with some side effects. Common side effects of tricyclic antidepressants. Tricyclic antidepressants were most commonly used for treatment of depression in the past, but they often caused the aforementioned grogginess and weight gain, in addition to increased heart rate and blood pressure. Other side effects of some tricyclic antidepressants can also include blurred vision, dry mouth, difficulty urinating. While such symptoms were/are more common in older individuals than younger, newer drugs have been developed with the intent to decrease such side effects, so TCAs are not as widely used. Norepinephrine and dopamine reuptake inhibitors, NDRIs. Norepinephrine and dopamine reuptake inhibitors are typically used to treat clinical depression and have also been used in the treatment of Parkinson's disease. That said, NDRIs are medications that are effective in blocking the actions of transporter proteins. By doing this, they are effective in increasing amounts of active dopamine neurotransmitters, as well as norepinephrine in the brain. It is believed that by blocking the reabsorption of dopamine and norepinephrine back into the brain cells that release them, it allows a larger number of other neurotransmitters to remain available to nerve cells, which can help to relieve depression symptoms. This type of antidepressant is different from other types, including MAOIs, SSRIs, and SNRIs. Remember that dopamine is an important neurotransmitter that has an influence on a person's reality perception, ability to experience a sense of pleasure, as well as affects motivation. Norepinephrine affects the body's stress responses. One of the most commonly used NDRIs used today is Wellbutrin for Fivo XL, Wellbutrin XL, Wellbutrin SR, otherwise known in generic as buspirone. Side effects associated with NDRIs. Side effects associated with NDRIs include, but are not limited to, dry mouth, increased blood pressure, insomnia, agitation, nausea, constipation, tremors, headache, dizziness. It's important to note that while not everyone will experience these or other symptoms, others will. Be aware that Wellbutrin can increase the risk of side effects when used with tricyclic antidepressants, monoamine oxidase inhibitors, antipsychotics, and beta blockers, and other antiarrhythmic medications. Monoamine oxidase inhibitors, MAOIs. Monoamine oxidase inhibitors are not quite as commonly used as the SSRIs and are often a second choice if other types of antidepressants are not as effective as anticipated. The downside of MAOIs are the number of precautions and dietary restrictions regarding use. A person using MAOIs should avoid the use of common over-the-counter remedies, including cold and cough remedies. This classification of antidepressant shouldn't be taken with several other types of antidepressants, including SSRIs or tricyclic antidepressants. If you are prescribed this type of medication, consult with your physician regarding do's and don'ts of use. Important: MAOIs should not be used to treat forms of depression that are linked to bipolar disorders due to risk of triggering manic symptoms. Here's some brand name and generic names. Marplan, isocarboxazid, Parnate, tranylcypromine, Nardil, phenelzine. Side effects of MAOIs. Typical side effects of MAOIs include, but are not limited to, drowsiness, insomnia, nausea, dizziness, edema, weight gain, muscle pain, sexual dysfunction. Use of MAOIs should be carefully monitored by patient and physician. Some people using an MAOI may experience serious side effects that include serious food interactions that cause high blood pressure, serious drug interactions, increased risk of suicidal behaviors or thoughts, serotonin syndrome. Talk to your physician about the side effects. Be aware that people diagnosed with any form of heart disease or high blood pressure should avoid MAOIs. Every individual can react differently to the same kind of antidepressant. Some may provide relief for some and not for others, and the same goes to side effects. It's always important to be open with your healthcare provider regarding your genetic history, any and all medications, prescription and over-the-counter, or use of marijuana or other street drugs before you start taking an antidepressant. It's also important to remember that it can take several weeks, sometimes even up to 6 weeks, before antidepressants begin to reduce your symptoms. During this time, maintain contact with your physician so that he or she make adjustments to dosage or even recommend a different antidepressant. With patience, you and your physician can find the antidepressant or combination of antidepressants and at what dosage that works best for you. Chapter 5. When is it time to seek help? Depression and anxiety are often relative in regard to the person experiencing it. In other words, because people react in different ways to different stressors in their lives, it's often difficult to know exactly whether a person is simply feeling blue or is actually struggling in what can be likened to quicksand. In that regard, one might ask themselves, when does depression become normal versus abnormal, or even dangerous? Do I need help? Take grief, for example. Grief affects every person differently. It's perfectly natural for someone to grieve the loss of a loved one for several months, maybe even a year. But does that make the person who grieves for longer than that abnormal? Is it wrong or something to worry about? Everyone's emotions and reactions to tragedy, fear, loss, and even anxiety caused by the unexpected will be different. Depending on you and your typical reactions to things, you may start to wonder if you need extra help dealing with your anxiety or depression. Some slog through it on their own, but sometimes a little extra help might be needed. Remember that the classification of depression is a feeling of intense sadness. But who's to say how long or how intense that sadness should last? It doesn't have to be the death of a loved one that causes depression. It doesn't have to be a terminal diagnosis. Constant struggles to earn a living, deal with family issues and stresses, or even memories of the past can cause anyone to feel depressed on occasion. Some people express such feelings as being in a funk or they're feeling blue. As humans, such experiences are likely familiar to most. In many cases, those feelings might fade and you feel like you can get back into the swing of things. But what if you can't? What if you don't even know what's making you feel blasé or maudlin? It's not unusual to find people trying to deal with their depression on their own. In fact, it's fairly natural. You might be struggling with periods of ongoing depression or know someone who is, whether it's a family member, a friend, or fellow student or employee in your workplace. Should you say something? There are some who avoid issues or even discussions of mental health for fear of being rebuffed. Sometimes the mere idea of someone saying, "I think you need help," can cause a person to deny even to themselves that they don't feel right, especially when they can't really put their finger on what is causing their depression or anxiety. How do you know when it might be time to consider some counseling? Indications that you or your loved one may need some help. Again, it's important to remember that not everybody experiences depression or anxiety the same way, to the same depth, or with the same intensity. Many people can hide their depression or anxiety disorders very well. Comedian and actor Robin Williams was one of those people who hid his depression for many years following his diagnosis and symptoms of the earlier stages of Parkinson's disease. How could someone who was always smiling or was pleasant to be around, laughing, or even living the good life and be stable financially, have a nice family and so forth, be struggling with depression? The truth is that depression can do a number on your perception of life. The dictionary defines perception as the ability to see, hear, or become aware of something through the senses, or a way of regarding, understanding, or interpreting something, a mental impression. The very idea of perception is the ability of the brain to identify and then interpret information that is absorbed from your surroundings. It is your perception that perpetuates or triggers your reactions to whatever it is that you see, hear, or feel. Depression is so much more than simply feeling sad or blue. Depression is not a character flaw or lack of inner strength, as mentioned before. Depression is an illness that can affect every aspect of your life. At its extremes, it may also make a person feel that life is simply not worth living anymore. Case in point, Robin Williams and numerous other famous people over the years, regardless of their wealth, their supposed stability, or their public personas. Such people are able to present a facade of normalcy that often takes even loved ones by surprise. Unfortunately, depression also comes with a stigma, and has for generations. That statement leads many to hide their depression from others. In many cases, someone suffering from depression may not even want to admit it to their loved ones. They don't feel comfortable speaking about it freely for fear of ridicule, disbelief, or public misperception. The first step towards seeking help, for yourself or for a loved one, is to recognize when it's time to bring up or consider the suggestion of seeking professional help. This can be a difficult conversation for many. Such discussions have triggered arguments, tears, denial, anger, and other emotions, both on the part of the person experiencing depression and on the person who is trying to do what they can to help. Only you, a loved one, or a close friend may recognize certain aspects of behavior that may give you or them pause. Below are just a few of the indications that it may be time to seek some kind of counseling to help you deal with your depression or that of a loved one. These are in no particular order, and the list is certainly not inclusive. It's simply a jumping-off point to help you identify some of the more common indications that you or a loved one may be struggling. Disruption of sleeping behaviors. Depression can cause you to feel tired and lethargic. You may find yourself or loved one sleeping more than usual. At the other end of the spectrum, you may be unable to sleep more than a couple hours at a time, no matter how tired or exhausted you feel. A number of studies have shown that there is a strong link between depression and a person's inability to obtain adequate sleep. The majority of people experiencing depression complain that they just can't seem to get enough sleep. Some are diagnosed with hypersomnia, a condition in which a person can feel extremely tired throughout the day. This is not the same as simply being tired because you had a bad night's sleep or your sleep was interrupted. This means falling asleep unexpectedly, at work, at school, or even in the middle of dinner. That's not to say that because you want a cat nap in the middle of the afternoon that you're depressed. Still, if you find that you simply cannot function without taking numerous cat naps throughout the day without gaining relief, it's time to pay attention. Changes in appetite. Depression can cause a person to either turn to eating for psychological comfort or turn away from it to the point of noticeable and not necessarily desired weight loss. Mental health experts caution changes in eating habits, overeating or undereating, that contribute to a person either gaining or losing more than 5% of their current body weight within 1 month's time is a cause for concern. While weight gain or loss may be gradual in nature, any changes that are not attempted deliberately for health and wellness should be noted. For example, a person who maintains a fairly regular diet and eats healthy with only the occasional treat might suddenly start turning to food as a panacea for their depressed emotions. Remember earlier when it was mentioned that those feel-good hormones also apply to food and the temporary pleasure that is gained from certain foods, especially sweets? Changes in grooming or dressing habits. A person struggling with depression may not even have the energy to pay as much attention as they used to with their personal grooming or dressing habits. Now, there are some people who simply like to dress comfortably and don't necessarily care to dress to impress. That's okay. Still, if you find yourself or loved one neglecting to bathe on a regular basis, to take care of their personal grooming habits, such as brushing their teeth, washing their face, brushing their hair, and so forth, it's time to pay attention. Feeling numb. A person experiencing depression will often feel a bit of disconnect to what is going on around them. They may go through the motions but lack the internal emotion or involvement with the situation, including conversation. Contrary to common perception, depression isn't always obvious. It may not always display with overt expressions or sadness, crying or outbursts of anger, or even verbal self-pity or deprecating comments about themselves. A person dealing with depression may simply not feel anything at all, even if they know they should. Many call it flatlining. This is not to say that the person affected by the depression may not smile or laugh or respond appropriately to what's going on around them, because they can. However, instead, they may simply be faking it to maintain the status quo. Inside, there is simply a feeling of apathy. Lack of interest in former activities. There's nothing wrong with changing your mind or putting off things, depending on what's going on in your life at any given moment. However, a person who suddenly stops doing the things that they used to like doing is a cause for concern. For example, someone who is always chomping at the bit to go fishing as soon as fishing season opens has no interest in fishing anymore. Or someone you know who previously loved to go hiking seems to find excuse after excuse for not doing it anymore. Depression can literally rob a person of joy that was once gained from hobbies and activities they previously enjoyed without reservation. At the root of the problem is lack of motivation or passion, which are prime targets when it comes to depression. Can't look forward. A state of depression, short or long term, can affect a person's ability to look forward to life, either tomorrow, next month, or next year. Optimism, planning, and struggles all seem to be a waste of time. If you or a loved one finds that you're in a place where you're unable to even find hope in the future, or even something you can look forward to, it's time to talk to someone. Avoidance. A person experiencing depression may find it easier to avoid interactions or socializing with others, even if such behaviors and engagements gave you much pleasure in the past. If you find that you're making up excuses more often than not so that you don't have to go out, take notice. It may seem that such interactions or outings simply don't give you the pleasure they used to, and can actually make you feel even more uncomfortable and self-conscious about feeling depressed. Things just don't matter anymore. Depression can cause feelings of apathy to the point where you or loved one may not even care that the car hasn't been washed in months, or you can't remember the last time you vacuumed. You may go through the motions and tackle only the most needed chores that need to be done around the house, such as the dishes or cooking for the family, and sometimes even that is a struggle. For some, anything more than that is simply overwhelming. That's because states of depression can not only make you feel lethargic, but destroy your inner drive or motivation as well. This doesn't mean you have to live like Martha Stewart, or that your home has to look like one profiled in a home magazine. But if you start finding that you're letting the laundry pile up, or the dishes are filling the sink more often, take note. The same applies to chores that were previously dealt with in a timely manner. Depression can take a toll not only on motivation, but productivity, and even worse, you may just simply not care anymore. The same thing applies to not only the home, but to work, school, or your business. Work ethic may decline. You fall behind on reports, tests, or deadlines. A student's grades might begin to slip, not because they're not smart enough to achieve them, but because they simply don't have the emotional wherewithal to care. You're an emotional roller coaster. Have your emotions been all over the map? Are they erratic? Do you get frustrated or angry easier than you used to? Does a loved one snap or snarl at you when you ask them what's wrong? Do you feel like you're suddenly walking on eggshells? Depressive episodes can take a huge toll on family, as well as marital stability. In many cases, those erratic emotions also contribute towards self-anger or guilt, which leads you to go round and round through a gamut of emotions without your being able to control them. Physical changes. Depression does more than change the appetite or sleeping habits. Depression can trigger physical symptoms also. People experiencing depression may complain about aches and pains, tension, upset stomachs, and reoccurring headaches. How can something that is emotional have an effect on your muscles, your bones, and the functioning of your internal organs? Remember earlier when it was mentioned that it can be difficult to diagnose depression? In many cases, that's true, especially if you or a loved one go to a doctor complaining of physical symptoms, such as GI problems, chronic joint pain, backaches, headaches, and so forth. Many people go to the doctor for relief of their physical symptoms without understanding or even telling their physician about their emotions or what's going on with them mentally, which is why it can be so difficult for physicians to make a diagnosis. Remember those neurotransmitters, serotonin and norepinephrine? Some studies have identified the link between depression and physical symptoms. In some cases, a physician might make the link between the two and diagnose a mood disorder, but some won't make the connection. Why? At its most basic, remember that sensations are passed through neural pathways. It's all about the chemicals that interact in the brain and in the peripheral nervous system that produce similar sensations caused by pain, anxiety, or depression. Have you ever noticed that when you're feeling sick or blue, that you notice more aches and pains? This is because depression can magnify sensations of pain to the point that just getting through the day is difficult. It works the other way around too. People dealing with chronic pain, the aftermath of an injury, pain caused by a disease process, or simple aging can lead to depression. Sometimes the vicious circle may seem never-ending. Important: if you're considering hurting yourself or committing suicide. Thoughts of self-harm or even suicide are one of the more serious signs of severe depression. Even if you have no intention of going through with it, you may find yourself thinking a lot about death and dying. Your loved one may be talking about it more, sometimes in an offhand way, other times more seriously. Some may engage in careless or dangerous activities or behaviors because they simply don't care whether those activities or behaviors will hurt them. If you're thinking this way or notice such signs in your loved one, please talk to someone about it. Don't ignore it, thinking that it will go away. Don't take chances. Speak to a mental health professional, a family doctor, or someone you trust to have your back, and to do what needs to be done to keep you or a loved one safe. These are just a few of the key indicators that you or loved one might be depressed. Now that you've become familiar with some of them, it may be time to seek some help for depression. But who? Who do you or a loved one go to for help? First things first, it's important to be somewhat familiar with the type of services out there when it comes to depression and counseling. While not an exhaustive list, some of the most common are described in this chapter. Chapter 6. Introduction to Counseling and Therapy Approaches. For those who have never seen a mental health care provider or counselor, the thought of visiting one can seem rather intimidating. Some are doubtful. Like many, the first impression of such counseling sessions is that you'll have to lie down on a couch voicing your deepest concerns, worries, or thoughts to a total stranger. Well, you can if you want to, but most counseling approaches are way more relaxed, and you don't have to worry. You're not going to have to look at ink blots. Some people are embarrassed to admit they're seeing a mental health counselor or therapist due to stigma attached to mental patients. But there is no one better qualified to provide you or a loved one with the tools, the insight, to help you or a loved one through their most difficult moments. Counseling therapies are often coupled with medications, but not always. It depends on the person, the situation, and the goals of treatment. In other words, counseling therapies are available to those experiencing depression, but none of them is a one-size-fits-all scenario. Some types of counseling may benefit one person and not another. It just depends what a person needs and what therapy or method they best respond to. Some people experiencing depression may never need to see a professional mental health provider. Instead, they may find relief by simply talking to or confiding in a close friend or loved one. After all, your friends and family are those that know you best. How are you supposed to be able to talk to a perfect stranger about your feelings, your emotions, and your symptoms? While it's difficult for some, it's important to encourage professional help, whether it's for yourself or a loved one. There is nothing wrong or shameful about seeking the expertise of a mental health counselor or therapist. Do what's best for you or a loved one. While some people don't want to talk about mental health care in the form of counseling therapies, others do. With a great understanding of depression and what it can do to those around you, including your loved ones, the less stigma that will be attached to it. The same applies to the most common types or methods of mental health counseling. That's not to suggest that most people hesitate to even admit they're depressed or anxious and struggling with it for fear of ridicule, feelings of shame or embarrassment, or even lack of respect or trust. Today, more people feel comfortable discussing such topics. Everyone reacts differently to depression and anxiety, and the same is true of seeking out professional counseling or treatment for their issues. However, denial is self-defeating. If you're struggling to make the decision whether to see a professional mental health care provider for your sake or for a loved one, remember one thing. This is you we're talking about. You are important. You are worthy, and you are valuable. A variety of depression counseling therapies and services are out there. Knowing and understanding what they are and how they work is a valuable tool for you or a loved one in making choices. Before you do, however, rest assured that if you find one type of therapy doesn't work, you can explore others. Don't let the term psychotherapy alarm you or a loved one. Psychotherapy is simply a term that refers to several different kinds of treatments that are available to help and identify the causes of a person's depression or anxiety. The goal of treatment is to promote a change of emotional thoughts and behaviors. Even more, to enable you to increase your sense of balance and stability in your life, and to learn ways to adapt to or overcome problems through self-reflection. Even subtle changes in responses and behaviors can improve outlook and attitude. Some therapies focus on one-on-one counseling, while others are done in groups. You'll find that all of them are designed to provide help and support. Information is power. It can be difficult for someone feeling depressed or anxious to seek help. Why? Because a sense of mystery surrounds many of the therapy methods and their approaches. After all, if you've never been to a mental health care professional, how can you know about what they do? The more you or someone you love knows about the availability of such therapies, the easier it may be to accept help. Taking the mystery out of cognitive behavioral therapy or other methods that can help you or a loved one deal with depression are important in taking those first steps towards treatment. A brief overview of the most common methods of counseling therapies follow. Psychotherapy, also known as talk therapy. Psychotherapy is defined as the type of treatment that is engaged through an individual or one-on-one basis or within a group. These days, this type of therapy is simply known as talk therapy. It implies talking, and that's exactly what happens during these kinds of sessions. You are talking to someone about yourself, about the things that concern you, and about your depression or anxiety. This type of therapy can help individuals with depression gradually resume the responsibilities or activities that they previously engaged in and enjoyed. This type of therapy can also help a person learn how to adapt to daily life pressures. Talk therapy is often used in conjunction with antidepressant drug treatments. Also, be aware that multiple sessions with a healthcare professional will likely be needed to help you or a loved one to change the patterns of thinking about issues and the thought processes that go into those issues. Drug therapies are often combined with counseling therapies for optimal results. It's important to remember that the drug therapies can help replace or balance the levels of and/or prevalence of neurotransmitters and neuromodulators in your brain. Talk therapy can include a handful of different methods of approach, such as cognitive behavioral therapy, cognitive therapy, and holistic or integrative therapies. Cognitive behavioral therapy has long been used in many aspects of psychotherapy and is considered quite effective in facing and dealing with challenges that many of us face in life, including depression, anxiety, and addictions. Cognitive behavioral therapy. Cognitive behavioral therapy, also known as CBT, can help encourage an individual to reduce their thoughts of hopelessness as well as negative thinking. At its most basic description, cognitive behavioral therapy is often utilized to help a person learn how to not only identify negative or anxiety-ridden thought processes, but to change those thought patterns. In the case of depression, this type of therapy would help to point out and define ways that a person might alter their thoughts and behavioral response patterns that have a detrimental effect on emotional health and wellness. Cognitive behavioral therapy is used to treat a number of issues, including, but not limited to, addiction, phobias, anxiety, anger, eating disorders, and even panic attacks. The ultimate goal of this type of therapy is to identify and overcome nearly automatic negative or disparaging thoughts, and not only overcoming them, but replacing them with more realistic, attainable, and positive thoughts. Cognitive behavioral therapy is an umbrella term for a number of different therapeutic approaches. These include, but are not limited to, traditional cognitive therapy. As mentioned, the traditional cognitive therapy focuses on the identification of faulty, erratic, or even distorted thought patterns, and one's emotional responses to aspects of daily living, as well as behaviors. How does it work? Basically, the therapist will help you to recognize how you think about things and your reaction or behavior to those things. If your actions or behaviors are more negative or less productive than they can be, your therapist can help you learn more helpful strategies to deal with the issues that might have contributed to your depression or anxiety. In other words, cognitive behavioral therapy focuses on a person's overall goals with treatment and are catered to the specific individual. You don't have to overanalyze what happened to you in the past or when you were a child. Rather, the focus of cognitive therapy is to help you recognize and deal with issues in your current environment. Traditional cognitive therapy is provided by a number of professional individuals, including psychologists, psychiatrists, counselors, and other therapists trained in the field. Some people engage in private cognitive therapy sessions, while others join groups. In fact, you don't always have to sit face-to-face with a professional, but can often engage in video calls if offered by the therapist. What can you gain from traditional cognitive therapy? The overall goal, again, is to help a person experiencing depression gain an understanding of how thought processes affect not only behaviors, but mood. Sessions with the therapist will typically involve a goal of some sort. In addition to regular visits, which typically last an hour, you may be expected to do some homework in between your sessions. Remember that cognitive behavioral therapy doesn't typically explore underlying rationales for your depression or anxiety, but rather focus on improving your response to stressors, behaviors, and emotional patterns moving forward. Multimodal therapy. This type of cognitive behavioral therapy takes a multi-dimensional approach to a person's psychological health, attitudes, impressions, and behaviors. Treatment focuses on a multi-pronged approach that includes imagery, affect, behaviors, interpersonal issues, biological or drug considerations, as well as behaviors. Multimodal therapy is a type of holistic or whole-body approach toward dealing with depression or anxiety. In other words, multimodal therapy incorporates all aspects of who you are, mentally, physically, and emotionally. A mental health care professional who practices multimodal therapy generally seeks to treat the whole body as one, without separating mental or emotional from physical. Depending on the situation, this type of therapy will also include medications to be used in conjunction with the therapy process. Several different kinds of multimodal therapy treatments or approaches may be used in this form of therapy. For example, training and relaxation, some that are emotion-focused, and some that focus on observable behaviors that are expressed by an individual in regard to their thoughts or feelings. In a nutshell, multimodal therapies may include a number of approaches used by a professional within a session, and can be catered to the specific needs of the individual and their goals. This type of approach is often used for those struggling with emotional problems that include not only depression, but anxiety, attention deficit hyperactivity disorder, some disorders along the autism spectrum, substance abuse, and eating disorders, just to name a few. This type of therapy may prove quite effective as it employs a number of methods or techniques all at once. In fact, many patients can explore different avenues or methods for their own treatment to enhance not only motivation, but encourage recovery. Keep in mind that not all mental health care professionals are well-versed in all the techniques involved in multimodal therapy, so some may not be as well-versed in those approaches as others. Dialectical behavioral therapy. Also known as DBT, this type of cognitive behavioral therapy focuses on the more negative, disturbing, or even destructive thoughts and behaviors that an individual might feel or express. The focus on treatment is to restore emotional stability and balance. This approach often utilizes techniques such as mindfulness. This type of therapy is slightly different than regular cognitive behavioral therapy, primarily because its goal is to teach a person how to live more in the now moments of life. It also seeks to inspire a person to seek more productive ways to deal with anxiety and stress, to learn how to keep a rein on their emotions, including those who struggle with regulating their emotions. This type of therapy is quite beneficial in treating those with self-destructive behaviors that can include substance abuse, eating disorders, and is also often used in the treatment of post-traumatic stress disorders. How does it work? Dialectical therapy techniques rely on dialogue between you, the professional healthcare provider, and sometimes others within a group setting. This type of therapy can be done on a one-on-one basis where your specific challenges are the focus of the health professional and guidance. Therapy will be focused on adapting your own specific behavioral or emotional reactions to certain circumstances or issues. In a group therapy scenario, a number of patients may gather together in an informal group setting and focus not only on behavioral techniques, but also in giving and receiving support to others in the group. With this type of therapy, a person experiencing anxiety, stress, or depression is guided to living more in the moment. It's a type of mindfulness where a person can focus on their own senses and feelings of what's happening around you in a given moment. It means incorporating all of the senses, touch, smell, sight, hearing, and even taste, so that you can concentrate only on what's going on around you in that moment and without any emotional response. Don't roll your eyes just yet. Mindfulness is not the same as meditation. It's simply a tool that can encourage you to simply slow down, calm your thought processes, and focus on other things around you when you're having a difficult moment. This type of therapy encourages people to maintain a sense of calm rather than instantly reacting to negative or impulsive behaviors. In other words, mindfulness in this type of therapy approach can be very effective in those experiencing anxiety and stress. How? By providing a sense of distraction and self-calming that can help get you through rough moments. This approach is geared toward what professionals call distress tolerance. The term defines a person's capability, which can be learned and practiced in order to more productively manage perceptions of imagined or actual emotional distress. When you're feeling emotional or you feel like you're losing your grip on your feelings, mindfulness and practicing distress tolerance can help. For example, if you're sitting at your desk and feeling overwhelmed, distract yourself, if even for a moment. A change in scenery from inside to outside, or vice versa, can evoke a number of neural responses in the brain as it adapts to your sensory surroundings. While this is an effective way to distract you from the most intense emotional responses or reactions or feelings of the moment, be aware that this technique is not used solely by itself. Simply distracting yourself momentarily won't necessarily solve your emotional issues that involve grief, anger, or fear. However, it can help to curb the acceleration of those responses and help you get to a place where you're able to deal with them more effectively. This is not to say that a person can make stress or anxiety completely go away. They're part of natural human responses. However, this type of therapy can prove effective in increasing your ability to deal with difficult emotions in a healthy, safe way. Rational Emotive Behavioral Therapy. This type of cognitive therapy, also known as REBT, focuses on the recognition or identification of irrational beliefs. For example, this type of cognitive therapy may be used in the approach to some phobias. In this therapy, those supposedly irrational beliefs are challenged. This type of therapy is also considered to fall under the umbrella of cognitive behavioral therapy, although the approach to treatment makes it different from other types. In this type of therapy, the approach is focused on taking action. This type of therapy is very effective in helping someone identify and confront irrational beliefs or behaviors and manage their own thoughts and emotions more realistically. It is especially beneficial for those who perceive an excess of negativity about themselves or even those around them. In its most simplistic terms, this method is focused on helping someone to respond more rationally to events that might cause anxiety, stress, depression, anger, and so forth. The techniques involved are especially beneficial to those who think negatively of themselves. This approach takes on several primary objectives and rationalizations. Bad or negative things do happen in life, accepting that, and that some things, such as natural disasters, are beyond your power to control. Even if you make many mistakes or struggle or even fail at times, doesn't mean you need to feel ashamed or guilty. Accept yourself for who you are. No one is perfect. Even when others don't behave like you expect or want them to, it doesn't mean that they're not worthy of acceptance or love. Sometimes people who are stressed or depressed often blame any number of external situations or experiences for their discontent or unhappiness. In other words, it's your cognitive interpretation of those events that trigger your emotional responses. There's an acronym that defines this process, known as ABC. In other words, an activating event, your belief or perceptions about the event, and lastly, your emotional response or consequence or beliefs regarding the event. For example, a person who is depressed may be encouraged to identify the origin or reason for the depression, whether it's environmental, physical, or financial. In this cognitive behavioral technique, the healthcare professional guides you to determine how your beliefs and thoughts might have contributed to the negative feelings associated with your stress, anxiety, or depression. In other words, this method encourages a person to try to determine the origin of their depression, stress, or anxiety. This isn't an easy endeavor for many. It can take many sessions in order to break down those walls, sometimes in conjunction with drug therapies, in order to enable you not to only accept, but alter beliefs, and eventually emotional responses. Irrational beliefs are relative to the person experiencing feeling on. For example, you might believe you have no control over your life, your satisfaction or happiness of life, or your ability to find some contentment in your life. This is only one type of irrational belief that this type of therapy might help a person to overcome. At the same time, it's important to recognize that someone who holds an irrational belief may find it very difficult to think otherwise, at least not in a healthy way. As you can see, counseling therapies can run the gamut of approaches, techniques, and beliefs. When it comes right down to it, these are all very important aspects to consider when it comes to seeking help. But there is also one thing to remember when talking with friends and loved ones: what not to say to a person suffering from depression. Chapter 7. What not to say to a person suffering from depression. As has been mentioned, it can be very difficult for a person to even admit that they're feeling stressed, anxious, or depressed. Primarily, this is due to feelings of personal inadequacy, but it's also often due to a hesitance to express any sign of perceived weakness to others. Depression is hard not only on the person experiencing it, but on friends, family, and loved ones. While those same people often mean well, they also often say things that can make a person retreat, feel ashamed, or feel even worse than they already do. After all, it's not like somebody actually wants to be depressed, or anxious, or stressed. If you know someone who is dealing with depression, it's important to take it seriously. If you don't know what to say or how to help, simply be there for support. You don't always have to say something. Be willing to listen without making any personal judgments. In other words, don't judge, don't criticize, don't make suggestions on how they can solve everything by just dealing with it. Among a number of things that you specifically should never say to someone experiencing or enduring depression is to try to minimize their feelings, emotions, or physical symptoms. Remember that depression is caused by low levels of valuable neurotransmitters in the brain. Would you tell a person diagnosed with diabetes to simply feel better without adequate medicine or changes in diet and lifestyle that could combat the very negative effects of the disease? After all, a person with diabetes cannot simply will their body to produce more insulin that can take away their symptoms or the dangers of those symptoms getting out of control. The same applies to depression. If and when a loved one does open up and admit they're feeling depressed, or you see that they themselves express feelings of apathy, lethargy, or that ongoing funk they're trapped in, be kind, be compassionate, empathize, and support them to the best of your ability. Trite phrases don't help. For example, don't tell the person in the throes of depression, "You know exactly how they feel." You don't. Every person's experience with depression may have similar symptoms, but not always. In many situations, a friend or loved one may also have experienced periods of sadness over one reason or another. But depression, especially clinical depression, is more than that. In simplistic terms, depression sinks much deeper into a person's psyche than simply being sad. Every person's experience with depression is different and is multi-leveled. That they need to be more positive. Telling someone that they need to be more positive when they're going through an episode or even long-term depression is not helpful. Remember that a number of hormones and neurotransmitters come into play with various forms of depression and its severity. Simply attempting to be more positive only skims over the surface of what depression really is. You can't ever really think yourself out of depression. Never, ever say it could be worse. Comparing depression, which is an invisible aspect of a person's personality, rather than its totality of physical symptoms, is like comparing apples to oranges. Yes, things could always be worse, but that doesn't help in the moment, does it? If a friend or loved one comes to you for any kind of emotional support, empathy, or even a touch of compassion, give it to them. Telling someone that it could be worse isn't helpful nor productive. In some cases, it can make a person feel as if they're unworthy of expressing how they're feeling. Just move on. Comments like "just move on" or "try to get over it" or "snap out of it" are definitely not helpful to someone who is depressed. Don't you think they would snap out of it if they could? Depression is not simply mind over matter. Imbalance of hormones, chemical transmitters, neurotransmitters, neuromodulators, and a myriad of other functions, or even malfunctions between brain and body, can have an impact on a person experiencing depression. Don't think about your depression. That's easier said than done. Often a person can't really put their finger on what has made them depressed, nor do they have any control over how their body, their mental and emotional self reacts to it. Telling someone to simply stop thinking about a tragic event, an illness, or anything negative is impossible. It's ingrained in the memory. In other words, you can't simply order depression or sadness to go away. Don't minimize their feelings. Depression can be very hard to get a handle on. Sometimes loved ones and friends get frustrated because the person experiencing depression doesn't want to do anything. They're apathetic and don't seem to care. This is true to a certain extent, but remember the old saying, you can lead a horse to water, but you can't make him drink. Simply put, you can't simply force someone to not be depressed. Many factors are involved in depression. Minimizing the impact that depression has on someone's life isn't helping anyone. Don't call them selfish. Dealing with depression is hard enough without someone putting a guilt trip on the person experiencing it. It's hard enough for a person experiencing depression to talk about it, to open themselves, to bare their very souls and innermost feelings, only to be called names because it's frustrating for those around them. Yes, it is frustrating and heartbreaking and sad, but someone who isn't suffering from depression doesn't know what it feels like to be mired in a kind of mental quicksand. Oversimplification of depression can feel belittling and embarrassing to someone dealing with it. While you may think you're being supportive or trying to simply cheer up your friend or loved one, you're actually doing the opposite. Resist the urge to be surprised or overwhelmed or speechless when someone tells you that they're struggling with depression. Remember Robin Williams. Very few people would have considered such an individual to be struggling with mental health issues. In fact, many were shocked. Just remember that people with depression can often hide their true feelings from their loved ones and friends very well, and for long periods of time. As you've seen time and time again, some people can hide their depression very well. They put on a mask of contentment and happiness, hiding their pain behind smiles and otherwise acting normal until they get behind closed doors. It's exhausting trying to hide depression from others because they're afraid of being judged. Some are afraid of the diagnosis and may fear that nothing or no one can help them. Others may feel confusion or even guilt or shame. The plain fact is that someone who has never been depressed doesn't really know how it feels or the detrimental effect it can have on everyday life. They have to hide it so that they don't seem incompetent at school or in the workplace, or they may fear that their friends and family may not want to be around them anymore. Here are a few more don'ts. Don't confuse depression with physical pain. In other words, there are two kinds of pain. There is pain that is physical in origin, and pain that is emotional in origin. They're both relative to the person experiencing them. Remember that what might bother you won't bother somebody else, and vice versa. What makes you stressed, anxious, sad, or blue might not affect someone else in the same way. Something that seems small or inconsequential to you may be totally different to someone else. You see it every day. A person might be afraid of snakes or bugs while you aren't. You might be afraid of walking over a bridge while others around you do it with glee, laughing at your silliness. They tell you you've got nothing to be afraid of. Does it make a difference? Does that make you wrong and them right? Or do you rely on your intuition, your gut, and respond in a way that your own feelings prompt you? The thing is, the something that has no effect on you or your behavior may seem challenging or even insurmountable to someone else, whether they're feeling depression or not. However, a person with depression may find many things in their lives as obstacles to overcome, but lack the tools to do just that. It's important to reiterate that some people experiencing depression don't know why they feel the way they do. They can find it difficult to pinpoint a specific reason for the depression. Every person's experience with depression is unique to themselves and their own emotions and attitudes. Don't cast blame. In other words, telling someone that they're being silly, that they're being irrational, or that they're putting too much weight on some of their feelings or emotions isn't helpful, but dismissive. A person who is told that they're imagining things or that they could cheer up if they really wanted to is judgmental and dismissive. This is especially true when depression triggers physical changes in the body, such as sleep cycles, eating behaviors, and even deeper, to aches and pains that can often be chronic in nature. Simply avoid pithy platitudes. It's one thing to try and be supportive and encouraging, but quite another to fall back on words that you may intend to be hopeful in nature, but can make a depressed person feel even worse. Such comments like, "Don't worry, you'll get over it," are not helpful. Saying something like that to a person who is depressed is like telling someone who just lost a loved one to simply move on. The past is in the past. They're gone, so now you can forget about it. It can be extremely difficult for a person who is struggling through depression to even be able to look into the future or to envision themselves in a future where they don't feel burdened by their depressive state, apathy, or the physical symptoms that often go along with it. No one volunteers to be depressed. It happens. Sometimes people get depressed because of their environment or because they're experiencing chronic stress, or they've inherited genetic factors that can increase the risk for depression. Supporting the caregivers. At the other end of the spectrum, it's also important for the caregivers, friends, and loved ones of someone experiencing and struggling with depression to take care of themselves. Feeling frustrated is unfortunately quite easy because you do just want the person to snap out of it and feel better, to be better. Caregiving is not easy. In fact, those caring for a loved one or friend diagnosed with depression need to take extra special care of themselves, mentally, emotionally, and physically. When you feel stressed, believe it. The person you're caring for is going to feel that stress. The same goes for frustration and irritability as well. Such emotions can often make the person you're caring for feel even worse. As a caregiver, a loved one, or a friend, just be there for them. Be willing to listen or to simply sit quietly in the moment. If you can't think of anything to say, don't say it. Just let them know that you're there for them. In many cases, the most valuable asset a friend or loved one can give someone struggling through a depressive episode is to simply listen. Chapter 8. Helping Yourself. So far, this book has provided an overview to understanding depression and how it affects the brain as well as daily life for many dealing with it. A brief summary of medications often prescribed in the treatment of depression, as well as different types of counseling therapies available, have also been explored. Now comes another important part, perhaps the most important part of all. What can you do to help relieve your symptoms? How can you find a balance in your life that will keep you moving forward? No matter the degree of depression, it's important to find ways to help yourself through rough spots. Therapies, speaking to counselors, and drug management are all beneficial, but in many cases, something else is also required. You. Your own efforts toward meeting your goals and what lies ahead in your future. This effort requires you to seek ways that you, yourself, can do something that helps make you feel better. After all, this is all about you. Even if you're in therapy or undergoing counseling with or without prescription medications, chances are that you may experience some down days, or at least those that are challenging. You are already familiar with some of the signs of depression, whether they come sporadically or are more constant. You know how you feel when it comes to your depression symptoms. Remember, not everybody will feel the same things with the same intensity. A number of strategies can help to keep depression at bay, or at the very least help to reducing your symptoms when you feel them coming on. For others, some of the following strategies, when done regularly, can also be quite effective in taming your depression and even the severity of your episodes and how you respond to them. Some of the following strategies involve more thought and patience than others. It's easy for someone who does not have depression to say, "Do this," or "Do that, you'll feel great in no time." Yet those struggling with depression know that at times nothing seems easy, especially when you're in the throes of its grip. It's easy to simply throw suggestions at a wall and hope that something will stick. Sometimes a solution can be found that way, but all of the following suggestions have been constructed with you in mind. They come from not only mental health experts, but from those experiencing depression and seeking ways to tame its symptoms. Anyone who has experienced depression or anxiety knows that a lot of suggestions for finding relief, peace of mind, and those smiles again is easier said than done. It isn't always simple. It isn't always fast. However, take a look at the following suggestions and see if one or more of them might work for you and help to lessen the brunt of your symptoms. Getting started is the hardest part, so don't put any pressure on yourself and don't make any grand promises or set long-term goals. Take it one day at a time. Hopefully, some of the following suggestions will be beneficial for you and you can engage in them regularly. Just get started. Remember that even though you may not believe it right now, you do have some control. For any of the following strategies to help you, start small. When getting started, do your best not to overextend yourself. Even more importantly, don't feel disappointed if you don't feel any difference in your attitude or emotions right away. Rest assured that your brain is processing even the smallest of changes in activity. It's taking note of these changes that serve to stimulate new brain pathways, neural connections, and different chemical responses in your brain. Move. When I have experienced depression, the last thing I want someone to tell me is to exercise. But seriously, one of the most beneficial things that you can do for your body and mind during episodes of depression or apathy is to get moving. Cater your activity or exercise to your age and fitness capabilities. If you can manage a good, hard workout is one of the best ways to get you over those speed bumps. Why? Exercise stimulates the production release of those feel-good endorphins discussed in an earlier chapter. Now don't groan at the word exercise. Exercise is simply movement. For example, if you like to dance, dance in your living room to some of your favorite songs. Even a few minutes of letting yourself go and dancing, any style, can be enough to boost energy as well as mood for a few hours, which may in turn encourage you to do something else. Simply going outside and walking around for a few minutes has a positive effect on the mind that oftentimes we forget. Those who experience depression find it can be quite difficult to motivate themselves to get up and do something, even a few minutes of dancing, but efforts will be rewarded. You might not feel any different, but you can be sure that your brain is computing, transmitting, and sending signals at light speed throughout your brain, triggering the manufacture and release of hormones and other chemical messengers. Following are just a few positive benefits that any form of exercise, movement, can offer. Distracting your thought processes, clearing your mind when you're focused on a goal, you don't have any room for negative emotions or worries. Increased focus on your body and how it's feeling and functioning rather than what's going on inside your brain. Movement requires more brain activity and neurotransmitter function than simply sitting, right? When you exercise, more areas of your brain are going to be active or stimulated. This is especially true if you're doing some kind of exercise that you've not done before, such as something requiring coordination or attention to detail. When you're concentrating more on your breathing, on how you need to hold the weights, or even how you place your feet, your brain is working along different neural pathways. Exercising 3 or 4 times a week has been shown to help decrease symptoms of depression, as well as anxiety, due to the release of serotonin, dopamine, and norepinephrine, all of which are responsible for and have a huge influence on mood. 3 to 4 times a week can be difficult, so start with 1 or 2. Even 10 minutes is a good start because it's a start. If you're able, a good, hard workout is especially beneficial. Whether completing a round of weights at your local gym or in your garage, the key is to safely exercise as hard as you can, focusing only on the physical feelings and sensations in your body. This doesn't mean to imply that you should go out and run as fast as you can for a mile if you haven't done it before, or attempting to lift weights that are too heavy if you're just starting out. You don't want to do that. Baby steps. Get your brain signaling, get it communicating, get it stimulated. Exercise with as much intensity as you can without overstraining. Even if you've been inactive and relatively sedentary for a while, any movement, such as pacing from one end of your apartment or home to the other and back again, is enough to get your brain activated and busy doing something besides waiting. Exercise will get those happy hormones brewing and traveling through the circuitry of your brain, through your glands and through your body. You can take comfort in the thought that though your muscles may be aching and tired when you're done, your mood might feel a bit lighter. Perhaps not for long, but remember, baby steps. Routine exercise is also recommended for anyone struggling with anxiety. The more you move or exercise, the more your brain releases those feel-good hormones and neurotransmitters. As this is happening, the brain itself is changing. It's an action/reaction type of response. When you feel that post-workout high and that sense of pleasure you've gained from challenging yourself with successful results, you'll definitely want to feel that again. In fact, you may find that exercising at least several times a week can even serve to change your thinking and your thought processes. With exercise, whether it's for weight loss or getting rid of tension caused by stress and anxiety, or simply distracting yourself for your own thoughts, you feel a sense of satisfaction in yourself. Your brain is doing just as much work as your muscles. Not only do you eventually see physical results of exercise, but your brain chemistry changes as well. Exercise triggers a cascade of chemicals, hormones, neurotransmitters, proteins, and the development of new neural pathways, just to name a few. When your brain is functioning more effectively and productively, you're going to feel better. When new nerve cells form, stimulated by exercise, they can have a very positive impact, especially when it comes to improving neural pathways that trigger emotional responses, and as such can help relieve symptoms of depression. A number of studies have been conducted over the years regarding the positive effects of physical activity and exercise on depression. The conclusion? That any type of physical movement or exercise is as comparable in some ways as antidepressants and some cognitive behavioral therapies for many people. Do not stop taking your medication and opt for exercise instead. However, let your healthcare providers know what you're doing and discuss results with your healthcare provider. While exercise, especially hard exercise, can prove effective in relieving bouts of depression, motivating yourself to get up and get moving can be quite challenging. Remember that one of the symptoms of depression is a lack of desire or incentive to do something, even if you know you should. Getting over the lack of motivation hump. Motivating yourself can be tough, and no one is saying it's going to be easy. It's also important to know ahead of time that one brief explosion of exercise and physical activity is not going to make your depression disappear. Taking the slow and steady wins the race approach is beneficial. However, keep several things in mind. Choose the type of exercise that is catered to your current physical status and capabilities. For example, if you've been sedentary for a while, you might not want to start with a mile run. Instead, make yourself go outside and walk to the end of your driveway. Then maybe to the street corner. Maybe then around the block. You don't want to hurt yourself. Pick types of exercise that you believe you'll enjoy. If you don't like riding a bicycle or jogging, don't pick that. Don't push yourself when just starting out. When just starting out with exercising on a regular basis, start by doing the activity for 5 or 10 minutes. Gradually increase by 5 or 10 minutes every few days. Give yourself several weeks to get into a pattern or routine. As you grow stronger, and as you find yourself looking forward to those moments of exercise and physical activity, you can increase the length of your workouts. Exercising for relief of depression symptoms is not a one-size-fits-all, nor is it a one-time thing. When you choose a type of exercise or environment that you enjoy, take things slow and steady. You may discover that this is something you want or need to keep doing. That being said, some recent research has determined that those who engage in higher impact or intensity workouts overall can experience a higher increase in endorphin levels than those who opt for less strenuous or demanding exercise routines. Does this mean if you don't do a high-intensity workout that you're not going to benefit from exercise? Not at all. In fact, even an hour of exercise on a weekly basis can be beneficial for many who struggle with depression. Not everyone is capable of vigorous or high-intensity training or aerobic activity. So again, talk to your primary care provider regarding your overall health and wellness and physical conditioning prior to starting any new exercise program or routines. Lack of exercise can increase risk of depression. Lack of exercise can exacerbate depression, according to some recent studies. Take heart in the fact that even little changes in your physical movement can have a positive effect on brain function and chemical production. For many, depression causes that dreaded lack of motivation or desire to do anything. For some, lack of exercise coupled with other symptoms of depression, including overeating or comfort eating, can lead to weight gain, physical aches and pains, especially in the joints, and further decreasing one's sense of self-esteem. It's a never-ending and quite vicious circle of emotions. Even though you know you should exercise and it will be good for you, your inability to get up and just do it can make you feel even worse, which worsens the continuous and downward cycle of negative emotions. A lack of physical activity can trigger a number of negative emotions that not only make a person feel downright moody and irritable, but can send them deeper into a depression. How does that happen? Remember that exercise releases those feel-good neurotransmitters. When your body is functioning at optimal levels, other functions are also occurring in your body, including a robust immune system. When you're sedentary due to lack of motivation or stress or depression, chemical reactions found in the body's immune system, such as cortisol, the stress hormone, can increase the risk for exacerbating negative emotions, which also lead to worsening symptoms. So get up and get moving, even for short bursts of time. The more often you engage and incrementally extend your exercise time and intensity, you might find that more often than not, those feel-good hormones are helping you over the rough spots. Another effective method of helping yourself is to find a hobby. Find a hobby. It may sound trite for someone to tell someone who is depressed to, find yourself a hobby, you'll feel better. But it's actually true. Perhaps not in the way it's spoken, but in how it can help. In other words, doing something that you enjoy or something that you used to enjoy, like exercise, triggers the release of endorphins that not only make you feel more motivated or energetic, but may put you on a more even keel. While your depression or your struggles with it may not go away immediately, any positive effort you make goes a long way and can help you regain some control over your life. Also keep in mind that a hobby doesn't have to be expensive or super involved. For example, reading. Requesting books from your local library won't cost you a dime, but has the potential to engage your thought processes, your imagination, and your ability to get outside of yourself once in a while. When you're depressed, watching something on TV that makes you smile or laugh can also help jolt you out of the early stages of a depressive episode. Did you know that laughter can have an influence in altering the levels and activities of serotonin and dopamine in the brain? In fact, there is a type of cognitive behavioral therapy that focuses on laughter and its benefits in improving social interactions, as well as psychological and physical quality of life. It's called laughter therapy. You can believe it, it's real. Laughter has also been shown to prompt a decline in stress response release of hormones and transmitters, including cortisol and epinephrine. Laughter increases production and release of serotonin and dopamine, which can lighten your mood, not just for a minute or two, but for hours. So look on Netflix or Hulu for your favorite comedian or someone you think you might enjoy. Hobbies, or anything else that takes focus or attention onto something other than your depression, encourage changes in the brain. That focus also releases neurotransmitters that work on stimulating the mind and incorporating your other senses into what you're doing. Hobbies engage the release of pleasure hormones that are rewarding in nature. Remember the sensation of eating a piece of chocolate or smelling something delicious cooking on the stove? You might not be smiling on the outside, but you're certainly smiling on the inside. That's your internal reward system taking over. This is especially true when you're doing something you enjoy, whether it's gardening, painting, drawing, writing, playing a musical instrument, or whatever. When you do something that you enjoy, neurotransmitters such as dopamine are released. Sounds simple, doesn't it? Yet when you're doing something that brings you joy or even something that's meaningful to you, your brain is going to respond appropriately to the release of those neurotransmitters we've been talking about through this entire book. When you're engaged in a hobby, you may feel an enhanced sense of well-being. Hobbies that engage others can also help to stave off depression or relieve it through social interactions. When choosing a hobby, choose something you want to do and not something that society thinks you should do. Gardening or dirt therapy is productive, especially the pleasure you may gain from seeing something grow from your nurturing. Afterward, getting clean also helps to increase satisfaction and physical comfort. The brain can be quite ingenious, can't it? While you may not be able to always control your emotions, you do have the ability to influence them by your very behaviors. The more effort you make to alter the negative into the positive, or the sedentary into the active, the more those centers of the brain that produce those feel-good endorphins are going to kick into high gear. Another way to help yourself, especially in today's environment, is to unplug from social media. Unplugging. The statistics regarding the connection between social media and mental health issues, such as anxiety, stress, and depression, are not to be underestimated. No one today can doubt the prevalence as well as the influence that social media has on daily lives. Some of it is good, some not so much. Engaging in social media, especially consistently, can create anxiety and depression even in those who are not socially active. Not all social media is bad. In fact, there are plenty of avenues for not only social support, but encouragement for individuals experiencing anxiety, stress, or depression to be found online. This is especially true for those who are relatively isolated or who find social environments overwhelming. The link between mental health and use of social media affects all age group demographics. Some of the more negative aspects of social media that can influence and even increase the risk for depression includes social pressures, peer pressure, cyberbullying, and increased levels, whether conscious or not, of decreasing in-person interactions with others. How can you tell that you're spending too much time on social media or other online activities? If your use of social media triggers changes in how you go about your daily life, influences your feelings, mostly negative, or how you think, it may be time to consider unplugging, or at the very least, limiting your excursions into social media platforms. While social media enables us to stay connected to family and friends, especially those that are not physically or geographically close, it also comes with some risks. It all depends on the type of communication that you are engaged in and how it makes you feel. Constant browsing of social media, as well as news feeds, can be filled with depressing, violent, or disturbing news. Sometimes it seems never-ending. For some, social media has become the end-all to finding out what is going on in the world around you. At the same time, it can be quite destructive, especially for those who are already struggling with depression, isolation, or anxiety, regardless of its causes. You might want to ask yourself a few questions to determine whether your social media engagement is doing you more harm than good. For example, after you're done browsing, do you feel better, worse, or indifferent? After interacting with others in social media environments, do you feel calm or anxious? Do you find yourself growing irritable when browsing through social media feeds? If so, you might want to cut back. In some scenarios, social media can be quite toxic in nature. It's unfortunate that people often compare their own lives to those on platforms such as Facebook. It's like competing with the Joneses in hyperspeed. You've got the celebrities, the influencers, the perfect people who are always smiling, looking great, and so forth. So much so that a person who is struggling with anxiety, depression, or stress in their lives may feel that they're inadequate or that they're somehow defective or of weak character. Ever look at someone from high school that seems to have their life together or more rewarding? Facebook stalking decreases serotonin because we, as humans, naturally have a jealous and competitive nature. This is true even if we are not super competitive in most of our life's activities. However, it is always important to remember that platforms such as Facebook, TikTok, Instagram, and others enable people to only put their best foot forward, or at times simply lie about how happy they are or how much money they make, only sharing the good when quite the opposite in real life may be true. In other words, social media and how it affects you depends on you yourself, such as how you use it and why you engage in social media. The results of a study determined a few negative ramifications that social media can have on the millennial population. For example, some of the key indicators for millennials when it comes to social media uses and their negative interactions in regard to depression can include, but are not limited to, feeling disturbed or somehow lacking if they followed less than 300 Twitter accounts or having only a few followers, feeling bothered by a perceived unflattering photo, posting photos of themselves alone rather than in group settings, comparing themselves to others that they think are better than themselves, engaging in social media to the point of being ranked higher on the social media addiction scale. The answers of the social media addiction scale include giving yourself a ranking from very often to very rarely. Some of the questions include: you spend a lot of time thinking about social media or planning how to use it. You feel an urge to use social media more and more. You use social media in order to forget about personal problems. You have tried to cut down on the use of social media without success. You become restless or troubled if you are prohibited from using social media. You use social media so much that it has a negative impact on your job/studies. One of the dangers of spending too much time on social media, as well as worrying about what others might think of you, is the increased risk of ruminating. Ruminating is a fancy word that simply means you're thinking about something very deeply. You can't seem to let it go. It sticks in your mind and goes round and round. Rumination is emotionally dangerous to people who are already anxious, stressed, or depressed. Strategies to reduce social media usage. It's not surprising to find the majority of those around you looking down at their phones, constantly. Instead of connecting to the world immediately around them, they're reacting to the world through their phone. Can you be addicted to social media? Yes, and it's just as challenging to quit as many other addictions. A large percentage of people today feel a sense of horror and maybe even panic at the thought of unplugging from social media. It's their lifeline. Cutting back on social media takes effort, and like anything else, developing a habit can take anywhere from 10 to 14 days to notice a difference. However, there are strategies that can help you do just that. Limiting your daily usage of social media. As an experiment, track how much time you spend on social media every day. Be honest with yourself. It doesn't matter what social media apps you use, what sites you're visiting, or how many. It's about determining the overall amount of time you spend on social media sites. You might be amazed at the final tally. Quitting social media completely isn't always necessary, but limiting the amount of time you spend on your social media apps and channels can help reduce anxiety, stress, and depression for many. Chances are the spent time is on the most popular apps such as Facebook, Twitter, TikTok, Snapchat, YouTube, and Instagram. There's probably more, but these are the 5 most commonly used. So when starting to limit your daily usage, first figure out how long you engage on each of your favorite social media channels. Through the day and into the evening, consider this. If you spend an overall 30 minutes a day, and it could be more, browsing and/or responding on each of your social media apps, you do the math. It can be alarming to realize. Remember, this doesn't include browsing or watching news sites or whatnot. It's just social media. To cut down on social media, you'll need to start by rationing yourself. Give yourself a set amount of minutes for checking in with the site and/or responding to comments. Start with 30 minutes and then gradually decrease to 15 minutes a day on all of your social media accounts. Check in and get out fast. Soon, you'll realize you can live without them. The hardest part of cutting off social media is that lack of connection you feel with others. However, if you're like most people, you don't even know the bulk of the people that you tend to respond to or exchange comments with throughout the day. To make unplugging slightly easier, consider making some rules for yourself. Determine which of your social media accounts are the most important to you. Determine what you get out of social media in regard to your relationships. For example, ask yourself why it's easier for you to engage in social media than be around a real-life friend or group of friends. Make rules for yourself. This is part of your strategy to help you climb out from under the boulder of depression, anxiety, or stress that social media can give you. Make your rules and stick to them. Give yourself an option that can help distract you when you start feeling that urge to overindulge in social media. A variety of social media sites provide tools that can help you track the amount of time you spend in different apps. Phone usage tracker apps are becoming more popular as experts have noticed that overindulgence with social media, which can be more detrimental than beneficial for many. In addition, many social media websites and apps, such as Instagram and Facebook, have tools that allow you to set time limits for your overall phone use, other than calling. The same can be applied to how much time you spend texting. Set daily time limits. The hard part is to not add more time when you run out. Self-discipline is discipline. Take a day off. Have you considered simply taking a day off from social media viewership lately? This is another strategy that works well for some. This doesn't mean turning off your phone or not taking calls or responding to text messages from friends or family. It means taking a day off from viewing any social media. If your only form of contact with a close family member or friend is on social media, you might need to ask yourself why. After all, you've got a phone in your hand, right? Start with 1 day a week, or even break a day into chunks. Stay off social media completely for an hour, then another hour the next week. You'll likely find that over time, staying off gets easier. This also cuts back on distractions, helps you focus more at work or school, and encourages rebuilding connections and relationships with family and friends in person. Have you noticed that some phone companies are producing commercials now that suggest putting the phones away at dinner time? Doesn't that say something? Disable those notifications. Those little dings or bloop bloops that let you know when you have a message or notification from a social media site can come in almost minute by minute throughout your day. Of course, you're going to look at your phone to see what they say. Just disable some of those social media notifications to reduce temptation and to help you decrease the amount of time you spend looking at your phone. Taking social media at face value. Of course, social media can be beneficial. It helps you stay up to date with news, family, friends throughout the day. You're able to network with others who share your interests. Numerous social media sites promote worthy causes. A person who is homebound or close to it often finds that social media is their only real connection with others. However, even too much of a good thing can be harmful. In many cases, social media can cause anxiety and depression, especially for those who tend to compare themselves to others. You know that not everybody tells the truth on social media sites. They elaborate, they boast, they can even lie. How do you know? That's just it. You don't. Many social media apps are manipulative, such as with photos of people. Unless it's done very badly, it's hard to tell sometimes when images have been photoshopped or airbrushed to the point that everyone looks perfect. You know that life in social media is not always real, but rather contrived. Still, keep in mind that people rarely discuss their true problems on social media, rather putting out the view of happy, contented, well-to-do lives. This can leave you feeling left out or that you don't have what it takes to be happy like they are. Some people start comparing themselves to others based on their supported incomes, images of their homes, which may not even be theirs, and so forth. For someone who's anxious or depressed, social media can increase a sense of isolation. It can intensify a person's lack of self-esteem, confidence, or even willingness to interact with others in real time. With depression, this kind of use or dependence on social media can also increase a sense of dissatisfaction, feelings of isolation, and may even prompt feelings of inadequacy. These feelings will only help to worsen depression. It is much easier to be condescending or insulting when hiding behind your computer. This is why bullying is so prevalent. Keep in mind that your use of social media and driving need to access it can be just as detrimental to someone dealing with depression as smoking, gambling, or drinking for another. It can become an addiction, whether you want to use that word to describe it or not. Can you deny that when you get a positive reaction to a post or a share, you don't feel a brief blip of pleasure? That's because the brain has released dopamine, the reward hormone, that is likened to that sense of pleasure you gain from eating a piece of chocolate or smelling something nice. These are just a few strategies that you should consider for yourself or a loved one struggling with depression. Give them a try, but remember to be patient. Helping yourself or a loved one through the rough spots is not easy, but it can be done. Even so, it's always important to remember that stress or depression not only affects the person suffering from it, but those who live with them. Try to care for them and love them. Supporting a person with depression is often difficult, but having a few tips at your disposal can be beneficial, not only for the person with depression, but for those caring for them. Chapter 9. Supporting a loved one with symptoms of depression. As a person who loves someone struggling with depression, you can help more than you think. You don't have to have a professional medical degree to do so. The most important things to know is what not to do. Some topics were covered in the previous chapter, and the ability to display empathy, patience, and persistence. A few suggestions of what not to do. In addition to the suggestions of what not to do that were given earlier, it's also important for a loved one to avoid pressuring or pushing a loved one to do something. In many cases, this can not only cause the person to dig in their heels, so to speak, but to resent you for making them do something. Instead, it's a matter of suggestion and invitation. It's important to try not to get tired of the "no, I don't want to" responses when asking a loved one to join in on something or go someplace or even go for a walk with you. Don't take it personally. This can be incredibly hard to do. After all, you're making suggestions and bending over backwards to make things as easy as you can for your loved one, who is going through short-term or long-term depression/anxiety. Don't take no as being rebuffed or ignored. You want to make the person feel better, but remember, it's about how they feel, rather than your own feelings about something. You might like to go for a walk around the block every evening, find it relaxing and nice, but that doesn't mean they will feel the same way. Don't give up. Even if you ask a loved one to do something with you for the 100th time, and 99 times they said no, or come up with an excuse not to, you never know. That 100th time you ask might be the charm. It's easy to grow discouraged when trying to involve or interact with someone dealing with depression or anxiety. It's hard to know where the lines are drawn. It's hard to know the difference between encouragement and pressuring. But don't give up. Avoid negativity. In times of frustration, a person might snap back at someone dealing with depression and say, "I'm tired of you saying no," or "You always say that," or even worse, "How can I help you if you won't help yourself?" Each and every one of those comments does nothing to encourage someone who is depressed. At the same time, your failures to invigorate, encourage, or motivate your loved one may make you feel frustrated or even angry. You yourself may struggle with sadness and fear. Most prevalent is a feeling of helplessness, sometimes to the point where someone will throw up their hands and just give up. Please don't give up. Such emotions are normal for any caregiver, regardless of the age, physical, or associated mental condition. Sometimes people think that their strength of will alone is enough to help someone over or through difficulty, especially through those afflictions that batter the mind. It's not. Remember that saying, where there's a will, there's a way. You and your loved one need to find the way that will work for them. Sometimes loved ones and other caregivers neglect themselves, which can lead to their own mental and emotional issues as well as a decline in physical stamina, strength, and wellness. Always take the time to take care of yourself. It's important. Your support for a loved one, regardless of their condition, is essential in helping them take the steps towards recovery. It's not a matter of erasing their depressive thoughts, but helping them to cope with them. Supporting a loved one dealing with depression requires empathy. The dictionary defines empathy as the ability to share and understand someone else's feelings. In other words, try to put yourself in their shoes. This isn't easy, especially for someone who's unfamiliar with how depression feels. We all have moments in life when we're sad or bummed, blue or in a funk, whatever you want to call it. You know how you feel during those moments, hours, and even days. You lack motivation. You find it hard to get excited or thrilled about anything. You know you don't want to feel that way, but you do. Eventually, most come out of those short-lived episodes with renewed interest, but for some, it could take longer, much longer. You can liken a person struggling with depression as walking through a tunnel. You can see the opening ahead of you and the one behind you, but even though you're trying, you can never quite reach either end, where you step into the daylight. Try to imagine what that might feel like. You may not think that your loved one is trying, when the opposite is true, because you're not seeing immediate effects or long-term results. Any loved one caring for someone with depression, be it a friend, family member, a wife or husband, will often struggle to find the methods that promote improvement in depressive symptoms. Again, depression is different for everyone. So too are their remedies. Medications help. Therapy helps. So can you. The importance of practicing empathy. Empathy requires you to face the situation without any negative thoughts about it. Remember that a depressed person can find it difficult or sometimes even impossible to do things. When you practice empathy, you also practice patience. Hiding the problem, making excuses for it, or simply thinking that you can talk them out of it isn't effective and can often make the person feel even worse. Remember, you can't just fix it like you would fix a leaky pipe. You can encourage them, but you can't fix it yourself. That is something they have to do on their own. Best thing you can do is empathize. How do you do that? Here are a few suggestions. Ask how you can help. A person struggling with depression may have no answer for you, but simply extending the concern and letting them know that you want to help can make a huge difference. In such a way, your loved one will know that you care. If they want to talk, let them talk. If they need you to do something for them and you are able, do it. The key is to simply be there for them. Let them know that you are there for them. Knowing that they have someone in their life that truly cares about them can make a huge difference in behaviors and attitudes. A person with depression will often feel as if they're nothing more than a nuance or a burden to their loved ones. Reassure them that isn't the case. Letting them know that you'll be there for them if or when they want to talk or ask for help can make all the difference in the world in their efforts to improve. Even silently sitting with someone, holding their hand or touching their shoulder can help to alleviate their feelings of isolation. The human touch is an amazing thing, and it has the power to convey emotion, concern, and support without words. Don't try to put a smiley face on everything. A person with depression can find it very difficult to see the good or positive side of things. What they're feeling is real. By negating their comments or feelings by pretending that everything will be just fine, that what they're feeling will pass if they just let it, and similar responses are only belittling to the person who sees a true issue or problem from their own perspective. This doesn't mean that you always have to agree with everything they say. You do need to be encouraging, but sometimes silence or a nod is all that is needed. Don't equate your own blue days with their depression. Comparing your own periods of blasé with someone who is chronically depressed or going through a very rough spot is a difficult thing to avoid. However, this can come across as a contest to determine whose symptoms are/were worse. It can feel very demeaning when you say to someone that you know how they are feeling when you don't. Even if you have also struggled with depression, this is something to avoid. One way of showing empathy may be to say, I can relate to, or understand, some of the feelings you may be having, but your experience is very different from mine. I'll do anything I can to be with you and help where I can. Of course, someone who has experienced moderate to severe depression and anxiety can often empathize and understand what a loved one is going through to some degree. The 2 P's, patience and persistence. Patience and persistence are essential when supporting a loved one with depression or anxiety. Many times someone helping another going through depression will have to dig deep for patience. They are also suffering, a bit differently. It's hard to watch someone you love struggle through quicksand, no matter how many ropes you try to throw them. A person struggling with depression often feels like nothing they do, whether it be medications, therapy, or exercise, will ever make them feel happy and contented again. That's where your patience and persistence comes in. Keep in mind that it takes more than medications or happy pills to pull a loved one out of the mire of depression. Medication, therapy, and your support are the most important things you can do to help a loved one who is struggling with depression. It's about getting them to a stable place or to a point where they can begin to actively and proactively take steps to deal with their own depression. Gentle persistence is key in trying to help your loved one. Gentle being the key word here. It's not about pushing someone, but softly and quietly prodding them toward that goal. It's about getting your loved one to a place where he or she will accept help and also accept the learning of coping skills to deal with the depression. Again, a person who has never experienced depression has no idea what it's like. It's sneaky, it's devious, and can pop up out of nowhere, especially in those dealing with recurrent depressive episodes. In other words, it can do a number on hope. However, there is good news. Those struggling with depression, and especially those that seek treatment, can achieve relief, or at least enough stability to maintain an even level much of the time. When a person with depression has reached a point where they can recognize the onset of symptoms, they can be much more proactive in heading them off. Finding hope is not like reaching for that ethereal pie in the sky. Many people dealing with depression and anxiety have succeeded in achieving relatively normal and stable lives. Can't that be said of anyone? Life is life. Things are going to happen that cause sadness, grief, anger, anxiety, stress, and yes, depression. However, whether you're struggling with depression or anxiety, or you have a loved one struggling with it, relief of symptoms and stories of triumph are out there. Chapter 10. Finding Hope. Stories of success told by men and women of all ages, socioeconomic or geographical backgrounds, are being told, especially since the stigma of mental health wellness has faded somewhat in recent years. Online venues and sites share numerous stories about personal experiences with depression. Stories from those currently experiencing, or having experienced, depression, anxiety, and/or stress are told more prevalently and let you know you're not alone. In one such case, a former law enforcement officer found himself extremely anxious, depressed, and stressed following a traumatic incident. His way of dealing with it was to turn to alcohol, sometimes even combining with overindulgence of alcohol and medications found in his or his friend's medicine cabinet. He knew and understood that such behaviors were detrimental and could be deadly, but at the time, he simply didn't care. He wanted to escape the pain of his emotions. Yet even as he did so, he also felt embarrassed, ashamed, and critical of his poor coping skills. Then again, he was hiding that detrimental things he was doing to himself from others in his efforts to climb out of the hole he had fallen into. How did this former officer get back on an even keel? He credits good coping strategies such as exercise, spending time in nature, and most importantly, sharing his experiences with others. Today, he serves as a mental health crisis worker, helping others who have been through what he has been, from someone who understands it. Nevertheless, he continues to take medications that help him with his general anxiety disorder and depression, and when necessary, seeks therapy sessions with his counselor. Another story is told by a young woman dealing with the severe out of post-traumatic stress disorder, PTSD, following a murder-suicide attempt by her former boyfriend. She survived. He did not. She turned to alcohol and drugs to deal with her depression, pain, and stress. She constantly tried to avoid reliving the incident, but found that near impossible. She did everything her therapist suggested, including practicing coping skills to help her with the flashbacks that led to her own overwhelming depression. She credits her success in overcoming the worst of her issues by accepting therapy and the support of wellness organizations. She had tried to cope with her anxiety and depression on her own, and finally turned to professional help. She learned about the neuroscience of depression and about those neurotransmitters and hormones that have such a huge influence on mood, behavior, and thought processes. She started keeping a journal, making a list of what occurred day by day, things that made her feel a little bit happier. On her bad days, she turned to those lists and realized that she could be thankful, that she could feel better, and that she could experience an uplifting of spirit. The more she achieved even small successes, the more proactive and hopeful she felt. She had better tools to recognize when she felt fragile that helped her maintain a positive attitude. Today, she owns a small business and seeks to provide an environment that makes her customers feel alive and hopeful for the future. Yet another story of struggle is that of a man who'd always struggled with depression and some anxiety, to the point he found it difficult to get out of bed some mornings. He knew such feelings were self-defeating, and sometimes even made him feel disgusted with himself. He felt like he walked around with a dark cloud over his head every day. Growing up, he hid his personal suffering from others to the best of his ability. He grew up in an era where it was considered weak to seek medication or therapy. He wanted to ask for help, but didn't know how to or what type of help might be best for him. He had experienced another person talking about such feelings, startled that no one offered an encouraging word, but rather were embarrassed. He dealt with his early years of depression by journal writing, talking to his journal like he would have talked to a therapist if one had been available. He found that one of his teachers from the university he attended had also experienced similar feelings, and who suggested therapy and medication to help control his symptoms. He finally took that step. For him, antidepressants made a huge difference in his life. He still has his ups and downs, but he also advocates for others experiencing depression and difficulty talking about it with professionals or even loved ones. He claims that he is now living a life of recovery, and every day learns more about symptom management. He even indulges in routine over-the-phone therapy sessions and connects with social network support groups online. Hope is out there. It comes in different forms and shapes, and like depression, is not a one-size-fits-all treatment plan. Dealing with depression and anxiety, stress, or any other negative emotion is challenging to anyone caught in the throes of it. However, with the support of loved ones, therapists, and appropriate medications, depression can be managed. Of course, the goal will always be to cure depression, but take it one step at a time. Learning how to identify your symptoms and develop strategies to manage and cope those symptoms can make a huge difference in how you feel today, tomorrow, and the day after. Afterword. Dealing with depression, often coupled with anxiety, may seem insurmountable at times, but learning about depression, what causes it, and how your brain works in producing the hormones and the neurotransmitters that cause depression are all beneficial in understanding how we, as humans, are affected. The vast number of therapies and strategies available today can help in the treatment of depression, stress, and anxiety. These include medications as well as a huge variety of counseling therapies, which today are conducted person to person, over the phone, or online. The stigma of depression is decreasing, thanks to the willingness of people who have experienced it and their ability to discuss it online, in books, and in social gatherings. Helping yourself or a loved one who is struggling with depression requires patience and finding the methods that work best for you or your loved one. It takes persistence and the ability to accept help or offer it. It takes empathy to support someone you love who is experiencing depression. But remember that there is a huge difference between empathy and sympathy. Remember that empathy is the ability to understand the feelings of another. Sympathy is the expression of pity or sorrow over someone's situation. A person with depression doesn't need your sympathy. They don't need to be patronized. They don't need to be ignored. They need help in climbing out of that quicksand. Sometimes the journey can seem to take forever. However, when symptoms are recognized and managed, you have just given yourself or your loved one the rope they may have been looking for to climb out of that quicksand and learn how to take steps to keep moving forward on a day-by-day basis. If you're struggling from depression, know that help is out there. It may take some time to find the right combination of medications, therapies, and lifestyle changes to reduce your symptoms and enable you to achieve a more balanced life. But patience and persistence is key.